So do you want to gain a deeper understanding of food allergies? Or maybe you're a parent, a caregiver, a family member, or a friend of an adult, a baby, or a child who has food allergies or you believe has them. Or maybe you're an adult who knows that you have food allergies or suspects that you have food allergies or intolerances and you want more information. And again, maybe you're a provider whose patients have brought up food allergies and you want to learn how to support them better. You are in the right place.
Welcome to the Radiant Health and Wellness community. Throughout each video training and masterclass, we explore perspectives designed to empower you and activate your radiant health, wellness, and vitality. My name is Dr. Beata Harasim, and I created the Radiant Health Protocol, an integrative system utilizing 6 pillars to master your health and wellness from within as you make your body your ally on your journey to optimal well-being. This protocol is the solution for various signs and symptoms, stages of life, diagnoses, and conditions. Join us as we take a deep dive into just one aspect of health and wellness right now. And these episodes are for educational purposes only. Please consult with your physician or a practitioner before making any changes. Let's go. Your journey to radiant health starts here.
Hello and welcome to the Food Allergies and Intolerances Masterclass. My name is Dr. Beata. Food allergies are such a wide topic, and today we're going to be decoding the most common presentations, including IgE-mediated allergies, non-IgE-mediated allergies, intolerances, reflux or GERD, eczema, celiac disease, CMPA, MSPI, FPIAP, FPIES, EOE, MCAS, food intolerances, food sensitivities, and more. And if you are breastfeeding a baby or a little one with food allergies, make sure you listen in as well. And as we go through, make sure you watch throughout the entire video to explore the differentiation of all of these different kinds of food allergies and intolerances that I mentioned. You're going to learn practical management strategies and gain a deeper understanding of how to support yourself or a loved one with food allergies and go on this healing journey. And I'm going to share more about my own personal experiences and my daughter's experiences and our healing journey as well. And as I go forward, I'm going to use the word food allergies as a global term to discuss and to cover all of these conditions. And I'm going to differentiate certain ones later on as we go, as we dive deep into each one. So you're going to get a really good understanding of them. And throughout this masterclass, I also encourage you to be interactive. When you are interactive, when you post in the comments and you interact and engage, you'll actually be able to remember more. You'll be able to incorporate more into your journey. You'll help others feel a sense of community, and you'll get this information out to even more people. And so if there's someone that you know who would benefit from learning more about food allergies, maybe it is a family member or a friend, a caregiver, a support group, a school system, whatever it may be, take a moment to tag them now and hit the share button. Because the more people that are aware of food allergies and know how to support others with food allergies, we are going to experience so much more ease and safety really in our lives as well. So make sure you share this video and this masterclass. Now, I do want to know, are you watching live? If you are, go ahead and do #live. If you're watching the replay, go ahead and do #replay. And let us know where you're tuning in from, because food allergies affect people all over the world. Myself, I'm in Massachusetts right now in the northeastern US, and I see clients in person in Connecticut and Massachusetts, and I also work virtually with clients all over the world. I've worked with families and individuals all over the US, in Canada, in Europe, and Asia thus far. So again, let us know where you're watching in from. And for those that are watching live and during May of 2024, which is National Food Allergy Awareness Month and Celiac Disease Awareness Month, stay with me to the end for a special offer that is only good until May 30th of 2024. And as we are watching, go ahead and let me know in the comments, who are you watching this masterclass for? Is it for yourself? Is it for your baby or your child maybe? Maybe it's for a family member or a friend. Maybe you're a practitioner who's wanting to learn more about food allergies and how to support your patients and clients better. Go ahead and put practitioner in the comments if that is you, because I have a new mentorship for practitioners to discover how they can use my approach, the Radiant Health Protocol, which I'll be talking more about in depth as we go through the masterclass, to transform health, wellness, and the lives of their clients, to access healing, to save time and resources, and make a profound impact on the world. Because we can overcome whatever health and wellness challenges are presented in front of us. And this is the way to get to all of the underlying root causes and absolutely transform anyone's experience. So also let me know in the comments, how old is the person with food allergies that you're watching for? And how long have they had food allergies? Have you been on this journey long, or are you just starting out? This gives me great information as far as what kind of support to provide for you, what kind of videos and masterclasses to make for you. And it's interesting to see the different ages. And personally, I've worked with the tiniest of babies. I've worked with toddlers and children. I've worked with teens and adults and women in menopause and seniors. So again, food allergies affects the lifespan, right? They can occur at any time, which we'll go over more in a minute. And, they don't discriminate to a certain age or anything like that. So also let me know, how long have you been into holistic and integrative health and medicine? Are you just starting out? Have you been exploring it for years? Or are you a veteran, again, maybe a practitioner or someone who has been really studying this for a long time? And I also want you to put in the comments if you are breastfeeding. So if you're a breastfeeding mom who has a little one with food allergies, or you yourself have food allergies, put breastfeeding in the comments. The reason why is I have so many resources for you, and this is how my personal journey with food allergies started. So I made so many resources because that is a subspecialty when we're dealing with the sensitivity of a little one with food allergies and that breastfeeding dyad. So make sure that you put breastfeeding in the comments, and I'll be sure to send you those resources. It includes free workshops, videos, trainings, and more. So as we get going here, I want you to know that I will be referring my notes, but please do post questions and comments in the chat, and I'll make sure to come back and read and answer all of them personally and give you lots of resources depending on your needs. And I did want to include this disclaimer as well, that this masterclass is for educational and informational purposes only, and it is not medical advice. Make sure you check with your provider and work with a practitioner before making any changes. All right, let's dive in. So do you want to gain a deeper understanding of food allergies? Or maybe you're a parent, a caregiver, a family member, or a friend of an adult, a baby, or a child who has food allergies, or you believe has them. Or maybe you're an adult who knows that you have food allergies or suspects that you have food allergies or intolerances, and you want more information. And again, maybe you're a provider whose patients have brought up food allergies and you want to learn how to support them better. You are in the right place. As a mom, a practitioner, and a mentor, I understand the challenges of getting answers and support when dealing with food allergies. Keeping yourself or your little ones safe, working through formula or breastfeeding challenges when they're little, figuring out what to eat, how to avoid triggers, how to manage reactions, sleepless nights, pain, and the guilt that comes when your child does have a reaction or if you slip up. I know the overwhelm, and I know the fear. I know the anxiety and the worry. It's hard. I want to validate that, and I don't want you to get stuck in that hardness. I want you to know that there's hope, and I want you to know that you will get through this, and your child will get through this too. And the reason why I say this is because I've been there. I know how you feel. I've been there personally. And as we go through this whole masterclass, I'll be sharing more about our journey. And so this hope that I want to spread is that not only will you get through this, but you will thrive, and you will be able to learn how to heal and experience health and wellness and vitality and radiance in ways that you never imagined. So I invite you to take a moment and put your hand on your heart and really feel that. Know that it is possible for you. It is possible for you to thrive with food allergies. It is possible for you to heal through food allergies and to overcome having reactions, signs, and symptoms. Take a moment to really internalize that and hold that space for the possibility and opportunity for you as well. Again, I know this because I've been there. My daughter's been there, and dozens of clients that I've worked with have been there as well. My daughter was one of the most sensitive that our practitioners have ever seen. And personally, she went from a list of over 40 triggers to a handful with much milder reactions, and the progress only continues. She was one of the most sensitive that our practitioners have ever seen, and we had the most work to do out of the ones that our practitioners have ever seen. And that's why during this process, I had to really uncover and discover the actual underlying root causes of food allergies and how to address them holistically for healing. So you don't have to waste your time on trial and error like I did. And if you're a practitioner, they don't teach this approach in school. That's why most allergists and conventional medicine doctors, they just haven't been taught this. They don't know. It took me years of trial and error, even after my doctorate, residency, and fellowship, working with various mentors, learning and applying different approaches to fine-tune the system. And I'm excited to get the word out and help even more people heal and achieve this radiant health and help other practitioners through my mentorship as well. And again, if you want to become a practitioner, if you are a practitioner and you want to learn how to use this system to get even better results for yourself, for your clients, for your families, save time and resources, and make this profound impact on health, on the world, put practitioner in the comments. Through this experience, my daughter's journey with food allergies, and my own journey of overcoming digestion struggles, food allergies, autoimmunity, and more, I've developed the Radiant Health Protocol. This is a revolutionary system with 6 pillars that addresses the underlying root causes of food allergies and any other health conditions and empowers you to address the root causes, to thrive, and to live your best life. Put a 1 in the comments if you want that. So in this masterclass, we're going to go in depth on the 6 pillars that will transform your health and how they relate to food allergies. I'm going to share about our food allergy journey. I'm going to share valuable insights and strategies that have been refined over years of research and practice. You're going to get a deeper understanding of food allergies. You're going to explore differentiation between the different types of food allergies and intolerances. And you're going to discover the signs and symptoms to look out for, as well as the contributing factors. You're going to learn practical management strategies. You're going to get encouragement and support from someone who's walked this path before and emerge stronger on the other side. So make sure you watch to the end, where I cover frequently asked questions. I address myths throughout the whole masterclass, and you're going to get tips and action steps sprinkled throughout so that you can start your journey today. And I'm also going to extend an invitation for a discounted support package for those of you who want to skip the mistakes, who want to get results faster, who want to feel confident and calm on this food allergy journey by working together. This includes a full month of support, a one-on-one consultation, assessment, evaluation, resources, multiple checkpoints throughout the month, and more to create your personalized plan and customized solutions for your healing journey. My name is Dr. Beata Harasim, and I'm a holistic and integrative doctor. And I work with clients with all sorts of signs and symptoms and diagnoses with the Radiant Health Protocol. And I actually began my private practice specifically to support breastfeeding moms of little ones with food allergies. And there's different names for this. It could be FPIs, CMPA, MSPI, FPIAP, MFPI, and more. We'll go into what all the abbreviations mean later on, especially if you haven't heard them before. Allergy breastfeeding is my subspecialty and a group that I hold so dear to my heart. Again, comment breastfeeding if this is you, because I remember how few resources there were when we were in the depths of this, and I have so many resources for you. Free workshops, videos, I even wrote a supportive book about our experience with guided practices for you, and more. And this book is actually really beneficial for anyone on this food allergy journey. I wrote about it in the context of my breastfeeding experience, but anyone going through food allergies is going to benefit with the guided practices, support, and strategies in this book. It's on Amazon. It's called Breastfeeding Bliss, and I'm going to talk more about it later. So as I was working with this breastfeeding population, I had moms approaching me who were formula feeding, who stopped breastfeeding and now their kids were older, who just had older kids, or the moms themselves needed support. So as I was working with this population, I realized that this approach that I created for myself and my daughter was so unique and transformative to support anyone, no matter what stage of life they were in, no matter what conditions or diagnoses they have, no matter what signs or symptoms they were presenting with. And especially food allergies, they are much more prominent than most think. Oftentimes they're undiagnosed or misdiagnosed, and they're prominent in both kids and the adult population as well. And we'll go into, again, differentiation and signs and symptoms in a couple minutes. So this masterclass is part of a full masterclass series. In this masterclass series, we go through the pillars of the Radiant Health Protocol, and they are holistic nutrition and nourishment, integrative detoxification, comprehensive gut health and healing, nervous system regulation, emotional energetics, and decoding the body. These 6 pillars are transformative. When you learn how to embody these and how to apply them, everything changes. The healing process can begin and accelerate. And the next videos after this one will each focus on one pillar of the Radiant Health Protocol with lots of tips and action steps throughout so that you can start transforming your health today. So comment series for the link to sign up for the entire free masterclass series to get bonus resources and to make sure that you don't miss anything. And if this approach of addressing root causes resonates with you, this holistic and integrative approach, and you're ready to identify and address what will create the shift for your food allergy journey, put Radiant in the comments and click below and get the discounted package with a month of support today. Because the truth is that you can't achieve wellness and optimal health and well-being by only looking at one pillar, whether it is an elimination diet or gut health or emotions or energetics. That's where we got stuck on our personal food allergy journey. And I discovered we needed a comprehensive, holistic, and integrative system. That's what I made the 6 pillars of the Radiant Health Protocol based on. And put a 1 in the comments if that makes sense, or put a 2 in the comments if this is new to you, because we're all at different places on our journey. And I remember when all of these concepts were really new to me. I had a degree in nutrition, I had my doctorate, I had my residency and fellowship, but putting all of these pieces together, and especially the emotional components, the energetic, the nervous system regulation, all of that was really new to me. And I was curious. I wanted to learn more because I was intrigued by it. I had seen people's testimonials and people sharing their stories of how much of an impact this made in their lives, and I really wanted to learn more. So no matter where you are on your journey, know that it's okay. If you're just curious about things, or if you have been learning about this for a while, all of this is going to be so important and apply to you as well. So what I've discovered is that the root causes, the underlying reasons for any signs, symptoms, or conditions are the same in each person, but they present themselves differently and to a different extent in each person. So in the food allergy world, some may have anaphylactic reactions. Others may get hives or eczema. Others may get vomiting. Others may get diarrhea. Some may even get mental and emotional symptoms, and many more. The root causes of all of these signs and symptoms, conditions and presentations are actually the same. And before we jump into the information and learning more about the root causes, I want to have all of you experience at least part of the system and the radiant health approach, because this is transformation that we're dealing with. This is health transformation. This is not just some information that you read in an article online. This goes way beyond that. This is an experience. And a part of this is understanding the difference that your journey, your food allergy journey, your health journey is having on your life right now. So I have 2 questions for you. And I invite you to grab a journal, a piece of paper, a pen, and just jot down what first comes to mind for you. And when you think of your current situation with food allergies, whether that's you, yourself, your child, a family member, a friend, how is this affecting your life currently? Food allergies don't come in isolation. They affect our lives as a whole. They affect our relationships. They affect our stress levels. They affect our mental and emotional health, our mental load, especially for moms. They affect time for business, for our career. They affect social situations, especially all the social events and things like that that have food in them. They affect social interactions, our finances when we're having to get special foods, etc. They affect the ease and the joy that we feel on a daily basis. And I invite you just to bring some consciousness to that. How are food allergies affecting your life currently? If you're watching the replay, feel free to pause and take a couple minutes to write down everything that comes to you. For those who are watching live, the replay will be available so you can come back to this exercise or just continue your journaling afterwards as well. All right, so question number 2. How would your life be different if you had clarity, confidence, and certainty on your next steps with food allergies? What if you knew how to approach food trials? You knew which foods to trial and which ones to avoid for your specific individual circumstances? What if you knew how to deal effectively with reactions when they did happen? And what if you didn't have that many reactions? How would that feel? How would that transform your life? What would become possible for you? And what if you gained new foods? What if foods that you reacted to in the past, you didn't anymore? How would that feel? How would that transform your life? What would become possible for you? I want you to spend some time really experiencing that. What if you knew how to support yourself or your child's body for optimal health and wellness and the best start to life? How would that feel? How would that transform your life? What would become possible? And what if you knew that this experience was actually going to set you up or your child up for radiant health moving forwards? How would that feel? How would that transform your life? And what would become possible? Take a moment to write down your thoughts, what comes to you, what emotions you're feeling, and experience the expansiveness and the possibility and the opportunity that is available to you. Now, this is an example of something that we do during the Wellness by Design mini retreat. So if that's something that you'd like to go even deeper onto and create this vision of your health and wellness and opportunity and possibility, go ahead and just put retreat in the comments and I'll get you that information. So now that you've got some clarity, let's get clear on your why. This is what's going to keep you motivated and inspired even when things get tough. Even when obstacles get in the way, we need to be clear on our reasons, our why first before we talk about strategies. So again, get that journal and I invite you to just jot down the first number that comes to your gut response when we're thinking of your why, your motivation, your inspiration. So on a scale of 0 to 10, how motivated are you to transform your food allergy journey today? 0 is not at all motivated or inspired. 10 is you are ready to go. You are signing up right now. What's your number? Whatever it is, there's no judgment. Nothing is right or wrong. Just write down whatever number comes to you first. What's your gut response? 0 to 10, how motivated are you to transform your food allergy experience and journey today? Now, the second question is, why didn't you choose a number lower than that? So for example, if you chose a 6 out of 10, why didn't you choose a 4 out of 10? Or a 3 out of 10 or a 2 out of 10? What is it that's motivating you? Because the answers are there. They are within you. This is something that I can't tell you. Every person is so different, so unique, and only you have it within you. And this clarity is what's going to get you through. This is your motivation. These are the reasons why you know that you need to make a change today, why you need to transform your food allergy journey and experience today, not tomorrow and not next week. And for those who sign up for the free full masterclass series, you'll also get a special guided practice to go even deeper on your why. So make sure you put series in the comments and I'll get you the link. So now I'm going to share a little bit about my story, our journey, my daughters and I, because this is not just some theory or philosophy. This is true lived experience for myself, my daughter, and dozens of clients that I've worked with. And so my beautiful daughter came into the world, and our journey began very early on with eczema, baby acne, colic, reflux, straight blood and mucus stools, vomiting, and many other smaller signs and symptoms. We were breastfeeding, and she would be nursing for up to 20 hours a day, and otherwise only wanted to be held or worn. I would hear her cries, and my body would feel like it was shutting down. And they weren't regular cries, no tears. These were screams, screams of pain that I can only imagine. And when she wasn't crying, they were phantom cries that would exacerbate my anxiety. I was a total wreck. I was confused, I was overwhelmed, and I was scared. I referred to this time as panic. Our doctors at the time weren't helpful. Family and friends didn't know how to help. And I set out to get my baby feeling better on my own with whatever information I could get. And I made so many mistakes. Even with my nutrition degree, my doctorates, all my healthcare background, I still made so many mistakes. I ended up going back and forth, not knowing where to go next. And through all of these mistakes, we learned a lot. We began with something called the breastfeeding elimination diet. I cut out food, so many foods. I kept cutting and cutting and cutting because we weren't seeing healing. We weren't seeing improvements. We had different reactions. We were down at one point to a 2-food elimination diet. Mentally, emotionally, I was drained. I had so much anxiety and worry, and the lack of support from my partner at the time, family, friends, having a hard time finding practitioners who understood what to do with us. That period of time was one of the darkest of my life. I finally ended up figuring things out on my own to a certain extent, and I started learning more and more about food allergies. We went to different practitioners. We went to naturopaths. We went to functional medicine doctors, but all they wanted to do was give my daughter supplements. And you had to wait weeks or months for appointments, but we needed questions answered now. And we went to an allergist. Oh, not to mention the supplements that they gave my daughter, she was so sensitive, she couldn't tolerate them. She actually had more reactions because of them. And when we did go to an allergist, I had this screaming baby in my arms because she was going through a reaction at the time. And I'm telling him what's going on. I'm pouring my heart out to him. And his response was, just feed her food. How do you think I felt? I felt completely invalidated. I felt confused. I felt overwhelmed. Like, what do I feed her? How? How do I do this? How do I make sure that she stops having these signs and symptoms? I didn't want to use Band-Aid solutions. I didn't want to use a medication that would just cover things up. I wanted to get to the root causes. Have you ever felt that way? that medical providers just don't get you, or they think that you're making things up. They don't actually listen to you. They don't validate your experience, and they don't guide you expertly. Because in that moment, when I was standing in front of this man, I was begging for help. I needed answers. I needed support. And what he gave me was the complete opposite. He didn't see me. He didn't see my daughter. He was looking at a checklist, and we didn't fit into that checklist. So he dismissed us. I want you to know that when we work together, when I work with clients, I validate your experience, because your experience is just as important as all the research that I've read and all the articles that are out there and all of my personal experience. Your experience matters. So when we work together, not just do I validate you, I guide you expertly. You get empowerment. You get clear action steps so that you leave our sessions feeling calm and confident, knowing exactly what you're going to do next. And I'm here for you. If there is a hiccup, if there is something that goes out of plan, you can reach out to me, and I'm here to guide you along the way. I'm here to hold your hand so that you don't have to feel alone like I did. Now, through this journey of helping my daughter, I actually discovered my own food allergies. I discovered my own leaky gut and poor gut health, which I had passed down to my daughter and which she had. We're going to go into that more. But leaky gut and gut health is such a cornerstone of our health. This is where food allergies begin. This is where autoimmunity begins. This is where our hormone regulation begins. And so I started discovering about gut healing, and I jumped into this gut healing protocol, and I made all the mistakes. Again, we saw healing, but I didn't know what I was doing. I was sleep deprived, and honestly, some things were confusing, and I didn't realize how much customization and individualization needed to happen for our personal journey and experience. I ended up working with a practitioner, and even though she knew the protocol inside and out, she actually had a hard time supporting us because of the breastfeeding relationship and all the food allergies. So, according to the protocol, you just go A, B, C, D. Well, we had to skip steps. We had to move things around. We had to modify things. And so throughout that process, she was mentoring me, but I was actually mentoring her at the same time. And we had this beautiful relationship, which really worked for us because I had my own background as well. Some of you may not. And so that's why my personal experience, I've made the mistakes so you don't have to. And that's the thing. I know how to work with these sensitive populations. I know how to help these little ones. And again, food allergies are more complicated than some think. Then on our journey came the other aspects. Nervous system regulation, because we got to a certain place of healing, but then we kind of got stuck, we plateaued. So I realized that this was missing, regulating not just my nervous system, but my daughter's. How do we co-regulate? And then the emotional aspects, the energetic aspects. And again, I went through multiple mentorships. I did so much continuing education, courses, learning, so that I could start getting clarity on how to apply these effectively, but also unlimited time. Because for the moms, you know how little time we have for ourselves. I had to figure out how to build this in. And that's the beauty of my approach, is I make this easy. I make this become a part of you and your identity. So it's not an extra thing on your checklist. It's not an extra thing to do. It becomes you. You are empowered on your healing journey because you literally transform who you are. So through this experience, I had this light bulb moment that why can't I help others? I have all this healthcare training and background. I have this lived personal experience. I didn't just read it in a book, right? I've gone through it personally. I made the mistakes. I've gone through the mentorships. And that's, again, how I started this practice. And so now you know why we're able to be here in this moment and how near and dear this is to my heart. And again, I wrote a book about our experience, especially the early years, because I knew that there were other moms, especially breastfeeding moms, who were going through this experience in that moment that needed support. And I had already built up a community, and the book did hit a #1 bestseller. And right now it's on Amazon, and it is on sale through Food Allergy Month. So again, this isn't just for breastfeeding moms, it's anyone on a food allergy journey, because I coach and guide you through practices and examples of how to communicate about food allergies, how to, interact in social interactions, how to express our wants and needs, how to really tune into how this experience is affecting our lives, and how can we use it to transform our lives for the better. So again, Breastfeeding Bliss on Amazon. Go ahead and check it out. It's on sale through the end of this month, May. So now let's jump into some of the logistics of food allergies. Food allergies are an immune response to a food, a substance in a food derivative, or cross-reactivity with the food. Our body's natural defenses overreact to exposure that they identify as dangerous, and this triggers a protective response from the immune system. So let's break that down, because we're going to get technical, but I want to keep it as easy as possible. I use 3 categories. One is IgE-mediated allergies, non-IgE-mediated allergies, and food intolerances. Those are the 3 categories we're going to place a whole bunch of different conditions and signs and symptoms into. So when most of us think about food allergies, the most well-known are IgE-mediated allergies. These can cause anaphylaxis, hives, swelling, and other symptoms as well, which we'll go into. They happen immediately to exposure and up to 2 hours after. And this reaction can even be to trace amounts, cross-contamination, and they can be life-threatening. The immune system releases a flood of chemicals that can cause the body to go into shock. This is called anaphylaxis or anaphylactic shock. Blood pressure drops, your airways narrow, blocking breathing. The pulse may become really fast and weak. You may get a skin rash or hives. You may get nauseous, vomit, have diarrhea. You may feel dizzy and faint. If this is happening, anaphylaxis needs to be treated right away. This is a medical emergency. I cannot emphasize this enough. This is a medical emergency. You need an injection of epinephrine. If this isn't treated right away, it can be deadly. So if you or someone you know or you see is experiencing this, use an EpiPen right away. Call 911 or the emergency line in your country. Get the person to lie down with their legs up or flat if they can't. And if it's a baby or a small child, hold them horizontally across your chest. The epinephrine in the EpiPen is adrenaline, which opens up airways and treats all the symptoms of anaphylaxis. There's a saying, epi first, epi fast. Even after epinephrine, there's sometimes a rebound reaction. And that's why individuals need to be closely monitored after an anaphylactic event. So for those who have experienced this, or the parents and caregivers of a little one who has experienced this, there are many emotions that come along with this as well. This is part of the healing journey as well. We need to process these emotions. We need to work through them, and we need to integrate them and also support ourselves through this process, because the stress levels of being a parent, a mom, a dad, a caregiver of someone with food allergies is high, and you need care yourself as well. And just a general guideline that I'm going to give is not to give antihistamines during a reaction, because what happens is they can mask the reaction. And antihistamines don't treat the swelling in the airway, which is what is life-threatening. So if you do have this type of allergy, an IgE-mediated allergy, you need to be working with an allergist, and you need an EpiPen. I still work with these clients with the root causes in conjunction with their allergist, but they absolutely need to be working with an allergist for skin testing, for oral food challenges and trials need to be in office, etc. These need to be done with medical supervision. Now, I still work with the root causes, which are supportive of this. And again, this is where the healing happens. The allergist is going to give you that medicine that is going to be life-saving. Both are equally important. So those with IgE-mediated allergies need to be aware of cross-contamination, trace amounts, and even shared lines in food manufacturing. Shared surfaces in a kitchen, at home, or others' homes. And I coach on all of this because this is the background stuff that you don't see when you see a typical food allergy diagnosis, right? People don't think of cooking. People don't think of communicating this with family and friends, with caregivers, with schools. I consult with school systems. I consult on 504 plans, which are medical plans for school as well. So if you're a parent with a little one, I consult on that, how to create a comprehensive 504 plan for you, how to advocate so your child gets the care and the treatment that they need. I work with teachers as well. I consult with teachers who have little ones with severe food allergies. Again, school systems, I coach on social interactions, right? So when we go out to someone's house, when we go out to a restaurant, etc., what are the precautions? What are the steps that we need to take? What are the plans that we need to have in place so that we feel confident and calm and empowered, knowing that we are doing what is in our highest and greatest health and wellness potential? Same thing with playgrounds, right? For little ones, I consult on how to deal with that circumstance depending on allergies. Again, visiting others, going out to eat, etc. I coach on the emotional aspects, the fear and the panic that many of us feel, how to stay calm, how to know what those next steps are, how to be prepared. This is the transformation. This is what transforms your experience. And with clients who do have IgE-mediated allergies, we work together to decrease the sensitivity and reactivity of the body and the immune system. Those are the root causes, to address those root causes and to heal. So again, the pillars that I work with are holistic nutrition. We need to make sure that we're not getting constantly exposed. And we also need to be aware of what are we eating? How are we nourishing our body? Because if we're only eating one or two foods, are we making sure that that is getting all of our nutrient needs, all of our nourishment needs? Again, the nourishment on an emotional and mental level as well, on a physical level. Then is integrative detoxification. And again, I'm going to go into these pillars in depth in a couple minutes. But integrative detoxification, our body is reactive, our immune system is reactive because there is a certain level of toxicity that is creating this immune response, that is creating this hypersensitivity in our body. Gut health and leaky gut are the root causes for food allergies. So when we heal the gut, when we heal and seal the gut, when we rebalance the microbiome, that is transformative. And that is when foods no longer become reactions, right? Our body no longer reacts to certain foods. We can heal that lining and we can decrease the reactivity and reverse it. Emotional energetics. When we work with the emotions and the energies of those emotions that are the underlying root cause of food allergies, that is where everything stems from. When we do that, again, we not only transform our mental and emotional health, we literally get physical changes, which I'm going to give examples of later as well. Nervous system regulation. When we learn how to regulate our nervous system, it changes everything. It allows our body to heal. It allows our body to optimally digest food. It allows us to do all the processes that our body has for metabolism, for digestion, for waste removal, for toxic removal, detoxification. All of these things are important to be able to work with. Then decoding the body, understanding what our body's communicating with us is absolutely such a crucial component, and understanding that our signs and symptoms, even of reactions, aren't bad. They're just our body communicating to us. It's our body's cry for help saying that something's out of alignment. So these are some of the things that I will be repeating throughout this masterclass, because again, these are the root causes for any of the conditions that we're going to be talking about today and more. And there are some things that I'm going to be repeating as far as management strategies, because they are the same as well for IgE allergies or any of the other allergies I'll be describing further on. These all apply. So the first myth that I want to bust and that I want to help you advocate for yourself or your child about is this phrase that a little bit doesn't hurt, quote unquote. Yes, it does. And this phrase is often said by well-meaning friends or family that maybe don't want you to miss out on something or have, attachments to food of their own, etc. And I think that the majority of them are well-meaning. They just really don't know. So I want you to know that with IgE-mediated allergies and others, this can trigger anaphylaxis, even with a trace amount, even with cross-contamination. This creates an immune response, even if it doesn't cause a full anaphylactic reaction. This stimulates your immune system and it activates your immune system. It increases inflammation and it increases the likelihood of more reactions. You're increasing inflammation, you're causing pain, you're causing harm to someone if you're giving them just a little bit. Over time, this inflammation, this can worsen leaky gut. It can actually lead to more food allergies. It can lead to autoimmunity and more. So if there's someone who has been saying this to you, someone who's near and dear to your heart, maybe a family member or a friend, and they just don't know, share this video with them now and have them listen to this component, because sometimes it's just a misunderstanding. And hearing it from someone other than you is going to help them understand the importance and the severity of this, because we don't mess around with this. We need to be able to advocate for ourselves and have boundaries around these situations. Again, that's something that I coach on, because one, it's the other people, but at the same time, sometimes it's us. Sometimes we feel like we're missing out, or sometimes we feel like we're maybe inferior or not worthy because we can't have XYZ food. This is a large part of the coaching that I do. I just worked through some of this yesterday with a client during our live program call. Because again, this is so much more than just food. This is our life. This is our entire experience. There's emotions that come along with this. All right. Now the next myth, or not necessarily myth, but something that you need to be aware of for management, is we need to be aware of every ingredient in the food that we're eating. And so this means that you need to become an expert in reading labels. You need to be an expert in recognizing derivatives in food products and other products, because things are not just in food. They're in personal care products, they're in supplements, they are in different teas and herbal preparations, etc. We need to be able to identify these. We need to know how to call companies, what to ask for. We need to know how to call restaurants ahead of time, how to advocate for ourselves at restaurants. And we also need to know how to talk to our children about having allergies, because we don't want them to be terrified of food, because that can lead to eating disorders and all sorts of other conditions. And that's not going to help regulate their nervous system. And we also need them to understand that this is serious. So that's something that I've had personal experience with my daughter. She is now 6.5, and I know that's going to evolve as she gets older and as we have different conversations and different social interactions to work through as well. So when we talk about this, right, knowing how to read labels, how to communicate, etc., I have a course specifically on this. I initially made this course for breastfeeding moms, so there is a component of breastfeeding, but then I go into the depths of how to read labels specifically for milk and dairy elimination. So if this is something that you're interested in, go ahead and put dairy in the comments, and I will get that course, or actually put course in the comments. Course will be a better trigger for me to know to get that for you. So that is a course that I have. It is self-paced, and then we touch base as well. And again, I coach on all of the allergens because myself and my daughter, we've been down to a 2-food elimination diet. So we have eliminated all the top allergens. We know what to look for. We know what derivatives are, how to avoid them, etc. So this is something that I am very familiar with, and I'm here to support you on because it can be confusing. I made that first course on dairy and milk because that seems pretty simple, and there's still a lot to it. There are at least 100 derivatives that I give in there. There are resources, again, on communication, advocating for yourself, how to know how to scour labels. Any processed food is going to be a potential to have ingredients, and you need to check them again and again because ingredients sometimes change over time. So this is so important. And I know many families who have been affected by this personally, by not being able to catch an ingredient change or not being able to read the label appropriately. And if that was you, there is no judgment, shame, or guilt because I've been there myself. So I know. I just want to give you the resources so you don't have to make those mistakes. And again, the top allergens we'll go through in a minute, but the ones that are a little trickier are especially soy, with soy derivatives, even gluten, different nuts, corn especially. I have firsthand experience with corn and corn derivatives. And this is something that is really crucial because corn is in processing and in very different places than you'd think. So you need someone guiding you through this journey to make sure that you're not getting exposure. Because again, that exposure is going to increase inflammation, increase reactivity. It's going to put your body into a hyperreactive state. The other thing that I want to mention is that IgE allergies can start at any time. They can begin again at any point in the lifespan. They can come on even after having multiple exposures to a food. And reactions may vary from time to time. So you may just get hives one time and you may have an anaphylactic relationship another time. It is all serious and it all needs to be managed appropriately. Again, for IgE allergies, you need to be working with an allergist. You need a medical plan, and you need an EpiPen. And I am here to support you to work through the root causes for healing as well. All right. Put a 1 in the comments if that was helpful. If you learned something new there, if there was something that you weren't aware of. And then put a 2 in the comments if you're realizing that there is more for you to learn, that there are still gaps in your experience, and that there are things that you need to put in place and put together for a transformative experience, for that confidence and clarity and calm and ease on your journey. Now, the next category I'm going to talk about is food intolerances. So there's been a lot of misunderstanding around this term, food intolerances, even within the medical community, and it's important to clear up. Because before I go into the larger category of non-IgE allergies, we need to make this distinction. So an intolerance is a difficulty digesting certain components of food based on a lack of enzymes. So when we say someone has a lactose intolerance, they don't create enough of the enzyme lactase to digest the sugar, the milk sugar, lactose, for example. That's why those people can drink Lactaid or take enzymes to help with digestion. It's just that they can't digest the lactose, that milk sugar in the milk. And that is different than an IgE or a non-IgE reaction. The immune system is not being directly activated and is not creating the symptoms. It is just a lack of the enzyme in digestion. So these people, those who have an intolerance, have purely digestive symptoms. This is usually diarrhea, constipation, undigested food in the stool, malabsorption. And this is, again, different than an IgE or non-IgE allergy, or an eczema reaction or hives, etc. Now, this, again, can start at any point in the lifespan. And sometimes babies can be born with this as well. This is rare, but it can happen. And I want to mention this because I know there are going to be some breastfeeding moms that are, and even not even breastfeeding moms, but just moms of little ones watching this as well. So when a baby has a lactose intolerance, they do not tolerate the regular formulas or breast milk, because breast milk and the regular formulas have lactose in it. Now, these babies never put weight on. They are failure to thrive. They are incredibly ill and not well right from the beginning. So that is something that's important to know. If you're seeing that in the hospital, in a family, a friend member, etc., have them do a test in the hospital. Okay, so there is something called a hydrogen breath test that they can do in the hospital, and they get results as far as if they're having a lactose intolerance. Now, in the Decoding the Body section that I teach, we also go over, if you're an adult, you can have this hydrogen breath test as well. But one of the things you can do is you can take an enzyme support and see if there's improvement. If that happens, then it's an intolerance. Because if it was a food allergy, taking an enzyme would not help you. One thing that I am just thinking of right now, I don't know if I went into testing really well for IgE allergies. I don't think I did. So let's mention that quickly right now. So IgE allergies, there are skin prick tests and blood tests that they can do. That's at the allergist. And that is how you get the diagnosis of an IgE allergy. That's important to mention. Because with those tests, you get confirmation that you have an IgE allergy to something. If that is positive, you need to avoid that ingredient, that food, at all costs, even trace amounts and cross-contamination. And you need an EpiPen. That's why that allergist is important for those. I'm going to go into more of the testing a little bit later, but I want to mention that now before I get too far ahead of myself as well. So with the lactose intolerance, right, we need to be aware of, one, babies can have this. It is rare, but it is possible. And, oh, where am I in my notes? Here we go. Okay, so it is possible. It can develop at any point in the lifespan as well. So again, there's lots of different ways that I coach on how to determine if you have an intolerance. But especially with babies, I just wanted to give you that information about the hydrogen breath test, because especially if you have a little one and they're having issues right from the start, make sure you get that test. And then if you need to, there are ways that there are homemade formulas that we can work with that I coach and consult on that are safe and nutrient appropriate and nutrient dense, not some of the stuff that you find online. These are going to be custom tailored. And there are specific formulas if you want to go that route as well. So when we talk about, again, intolerance, enzymes are created and secreted based on a whole digestive cascade. And we need to make sure that each step is optimized to make sure that the pancreas is making enzymes in appropriate levels and that they're being secreted at the appropriate time for digestion. So let's talk about this in a big picture, okay? There is a whole cascade that happens. So seeing food, putting food in our mouth, chewing and masticating the food, swallowing the food, going into our stomach, then moving into our small intestine, then our large intestine. There are, again, our liver and gallbladder are working in the digestive process. Our pancreas is working in the digestive process, and then it goes all the way through elimination. We need to make sure that all of those steps are optimized for optimal digestion. So even if you have a lactose intolerance or a different enzyme intolerance, or a lack of an enzyme that's creating an intolerance, we can work with your digestive cascade to actually improve that, to support your body, to optimize your digestion. I want you to know that you can be empowered and there are things that you can do to heal and to improve this. So when I work with clients, we work to optimize digestion. We work on, again, holistic nutrition so that, one, we're avoiding the things that are creating irritation and inflammation right now, and we're making sure that you are appropriately nourishing your body with the foods that you are eating, because if we have mineral or vitamin deficiencies, those are going to put more of a strain on our body. And when we're giving ourselves the nourishment and the nutrition that we need, again, on a mind, body, and soul level, we also look at integrative detoxification, because all those organs that I mentioned in the digestive process, they're also detoxification organs. So we need to know how to support them, because supporting those organs can improve your enzyme production and secretion as well. So we need to, again, work the integrative detoxification in there as well. Gut health. Crucial. Again, we're talking about digestion. We need to heal and seal leaky gut, and we need to optimize the gut microbiome. Again, I'm going to be going in depth on all of these in just a few minutes. Emotional energetics. So discovering what emotions are trapped in different organs, what energies of those emotions can create stagnation and blocks, and how they're affecting our digestion, how they're affecting our enzyme production, etc. How do we integrate those? How do we work with those? And how do we transform our emotional and mental experience? Nervous system regulation. So how does our nervous system, again, affect our digestion? Because that is absolutely related and such a key component that most people don't talk about. And again, we're going to be going over in depth in a minute. And then decoding the body. Again, our body is giving us messages. Something is out of alignment. How do we understand what the body needs? How do we give it what it needs? How do we detoxify what it needs to detoxify? How do we support it? How do we work with our body as our ally? So just like the IgE allergies, when we talk about a little bit doesn't hurt, right? If you hear that from someone, even with an intolerance, you're still increasing inflammation. You're still increasing irritation. You're creating pain and discomfort. You're creating digestive issues. Over time, repeated exposure can worsen leaky gut. It can lead to more food allergies, actual food allergies. It can lead to autoimmunity and more. We don't want to keep exposing our bodies to this without supporting our body optimally. There is a process and a way to reintroduce things as we heal so that we can start working with our body again so that it starts to produce those enzymes with graded exposure. There's a whole process that I work with clients on with this. And again, it's important to read labels. If you have an intolerance, we need to look and be aware of derivatives in products. We need to know how to advocate for ourselves when we go to restaurants. We need to know how to talk to our children if our children have this. Again, the course that I have for dairy specifically is going to be very appropriate to you as well, especially if it is a lactose intolerance. So go ahead and put course in the comments, because in there you get training essentially on how to read labels, how to look at derivatives, what are the derivatives to look out for, how to advocate for yourself, how to communicate your needs. This is so important to know how to do on your journey. And then again, we need to look at all of those 6 pillars for an ultimate health transformation. Again, a lactose or other intolerance can start at any time based on those root causes and how things are presenting on your journey. Another thing I want to mention is that people who have been on a vegan diet or lifestyle can have a intolerance and a lack of enzymes in digesting meat protein and other proteins as well after being vegan for a portion of time, because our body adapts. And so if you have been vegan and now you are attempting to eat animal products again and you're having a hard time, again, either with lactose or meat or anything like that, this is a sign that your body is not producing or secreting the enzymes needed to have that food in this moment. And that's where, again, working together is really important to create your custom plan on how do we work with your body to start supporting those organs, to start stimulating the production, and how to start creating a plan for your digestion to optimize that, again, on all levels: nutrition, detoxification, gut health, nervous system regulation, emotional energetics, and decoding the body. So that is an area that I specialize in as well. I actually did a great interview with this on the Radiant Health and Wellness show. So put vegan in the comments if this is you or you'd like more information about this on how to transition from being vegan to starting to eat animal products again. So again, just to recap, a food intolerance is a lack of an enzyme that creates difficulty digesting certain components of a food. This is widespread. The last research that I saw was that 65% of the population worldwide has a lactose intolerance. That's just lactose, not looking at any of the other enzymes. So not to mention the enzymes for fat digestion, for protein digestion, for carbohydrate digestion. This is also a part of the leaky gut presentation. Most people don't realize that their GI distress, whether it be constipation, diarrhea, stomach pain, irregular stools, and more stomach pain, this can be related. I'm going to be doing a whole masterclass just on digestion and GI conditions. So if you like that, again, just make sure you put series in the comments, sign up for that whole series to get the notifications and the access to that one as well. All right, so now non-IgE allergies. This is the third category now, okay? Non-IgE allergies are still a sensitivity of the immune system and an over-response of the immune system, but they are mediated through different antibodies and a different part of the immune system reacts. So that's why this is what most people call a food sensitivity, but it can have many different presentations that we'll go through. And I don't like the word food sensitivity because it is so broad and so widespread, and it doesn't give you an exact idea of what you're working with. When we talk about non-IgE mediated allergies, we understand it's an immune system response. That is so important to know because we deal with it a little differently. Okay, the treatment, the presentation, the navigation is going to be different. So what are some of the symptoms that you may be experiencing if you have a non-IgE mediated allergy? You may have GI conditions such as diarrhea, constipation, gas, blood or mucousy stools. You may have vomiting or reflux or GERD. You may have hypovolemic shock, which is from repetitive vomiting, which we'll go over more. And this is life-threatening as well. And so that's why it needs to be differentiated. When we're dealing with the immune system specifically, this is very serious. Hypovolemic shock is a medical emergency as well. I think I mentioned eczema already. You can have symptoms as brain fog, anxiety, mental and emotional health come up, hives, pain, etc. The signs and symptoms and presentations are very widespread and different and vary person to person. So again, I'm going to go through many of the different kinds. I don't know if I covered all of them, but many of the different kinds. And I'm going to give you an idea of the signs and symptoms to look out for now. And it's important to mention testing as well, because like I mentioned earlier with the IgE-mediated allergies, skin prick testing and blood testing with an allergist is the gold standard, as well as oral food challenges. Those are going to be the testing that you want to do. You need to have an allergist for that. For intolerances, there is a hydrogen breath test for lactose intolerance, and as well you can work with enzyme support to help test and support, and as well there's other ways to decode your body to understand what you're having and what you're experiencing. And then with non-IgE allergies, there are no great tests, so other than an oral food challenge. So let me go into this, right? If you have ever gone to an allergist and you had skin prick testing or blood testing and it came up negative, but you're like, hey, I have all of these symptoms, it came up negative because it was not an IgE allergy. It was a non-IgE allergy the majority of the time. Now, this is where the medical community, I think, does not support patients and clients well, because most allergists at that point, like we experienced, will say, nope, you don't have an allergy. Don't worry about it. Just eat, feed your child, do whatever. Well, you're going, hey, there's something happening here. They're getting eczema, they're getting stomach pain, they're getting bloody diarrhea, they're getting vomiting. We don't want to ignore that. But I want you to know that that will not come up on a skin prick test or a blood test. Now, same thing, there's something like that. It's called food intolerance testing or food sensitivity testing. What I want you to know, that is a tool, but it has very low specificity and it gives a lot of false positives. So this is not something that I typically recommend people to get. If you have, it is a nice thing to have, but it's not a necessity to have, because there are other ways that I coach on, especially in different methods and tests where we decode the body and start identifying what foods you are potentially reacting to. So I typically don't recommend this food allergy testing. If you'd like to get it, you can go ahead. It gives us some information, but they're not all that accurate. So I don't rely on them. Now, some of the ways that you can just start decoding the body, just based on some of the things that I'm going to tell you, are that symptoms are typically delayed with non-IgE allergies. So they're typically 2 hours or later, and they can be days later as well. Now, what happens with this is that it's tricky. It's not as easy to correlate causation, and it won't, again, show up on the skin tests and the blood tests at the allergist. So when we're working with non-IgE allergies, your signs, your symptoms, decoding the body, and your history are the most important here. And again, they vary widely person to person. So that is what I am an expert in, recognizing the patterns, starting to decode what your body's telling us based on your history, your signs, and your symptoms. Now, I do want to mention that even non-IgE allergies can be life-threatening. This is, again, something that most people aren't aware of. Some of the signs and symptoms and presentations we're going to go look through now. So one condition is called FPIES, F-P-I-E-S, food protein induced enterocolitis syndrome. This is something that I know very personally, and I have a whole masterclass that's specific just to FPIES. So if you would like that, just put FPIES in the comments. But what this presentation is, there are two presentations. One is an acute presentation. So this happens, again, about 2 hours after digestion, after exposure or indigestion, not indigestion, after eating the food or exposure to the food. So it's delayed about 2 hours, and it can have signs and symptoms like profuse vomiting, diarrhea, weight loss, dehydration, temperature changes, low energy, and you can have something called hypovolemic shock. What this is essentially your body loses such huge volumes of fluids, so especially through repeated vomiting, that your blood pressure drops, and this is a medical emergency. You need IV fluids. You need to get these adults or kids, these individuals, medical care as soon as possible. What happens often is that these families will go to the ER, and the medical personnel will be like, oh no, they just had a stomach bug or food poisoning. They just vomited a bunch. Don't worry about it. No, you know your child. If this is something that is repeatedly happening, or even the first time, if you have a gut response, I'm talking from a parent's perspective now, right? If you have a gut response, or if you're an adult that's going through this, and you vomited so many times, and you feel your body starting to shut down, get IV fluids as soon as possible. This is where it helps to have a written plan. This is something that I consult with to create your plans on, and to advocate for yourself, empower you to keep advocating until you get someone to give you IV fluids, because this is a medical emergency and this is life-threatening. We need to be able to hydrate because of all of that huge volume loss of fluids during the vomiting and diarrhea. Over time, people who have this may have failure to thrive. They may have food aversions because the experience is so horrible, okay? There's a chronic side to FPIES as well. And again, the signs and symptoms happen 2 hours after or more, even days after sometimes, from personal experience and clients' experiences. They include nausea, vomiting, stomach pain, diarrhea, bloody stools, reflux, vomiting, malabsorption of food, poor weight gain, and more. Now, again, FPIES is just one presentation. Let's differentiate it between other conditions that you may have heard of. The next one I want to mention is FPIAP, food protein induced allergic procticulitis. What this is just the lower GI symptoms. So things such as diarrhea, bloody stools, mucousy stools, stomach pain, cramping, malabsorption of food in the stools. When this happens, that's this category that I would go into. As I go into the different categories and labels, I don't want you to worry too much about them, but this may help to give you some insight. And the reason why I don't worry too much about the labels is because the root causes are the same. And for all of the non-IgE allergies, the treatment and the practice is going to be the same with the variations for individualization, right? So FPIAP, lower digestive. FPIES that we just covered is both upper and lower GI symptoms. Next is GERD or reflux. Now this is primarily just the upper GI system, okay? So this is with the esophagus. This is in the stomach as well, in the esophagus. And so we need to differentiate when we're talking about GERD and reflux. We need to differentiate between something structural. So this can be with the structures of the digestive system themselves. If it is a breastfeeding child or baby, we need to look at oral ties. We need to look at, again, if it's breastfeeding, the breastfeeding relationship as far as oversupply or heavy letdowns. And then we also need to look at the digestive properties themselves. So the timing of our food, the chewing and swallowing of our food, stomach acid levels, etc. So reflux needs some more diving into. That's where, again, this customization and individualization of working together really is important. Next, I want to mention EOE, eosinophilic esophagitis. Now, what this is an autoimmune condition that affects, again, the upper GI. So this presentation is similar because it is still triggered by certain foods, but what ends up happening is it is severe pain with swallowing, severe difficulty with swallowing, reflux as well. This is an autoimmune condition. So again, a little bit of a different presentation, a little different way of approaching it and treating it, but the root causes are still the same. Next is MCAS, mast cell activation syndrome. This is when our mast cells become overly responsive and release a lot of histamines, and there becomes a histamine overload in the body. This can lead to hives. This can lead to different global presentations as far as feeling unwell. It can have multiple signs and symptoms that we already mentioned earlier, including the GI symptoms. Now, with this is, again, a little bit of a different presentation, but it is food triggered as well. And it is something that I work with more. I look at this more on a global level and an immune system level as well. Next, I want to mention eczema. So eczema is a rash that appears on the skin. It is typically very itchy. And what happens is with eczema, we also need to look at differential diagnoses because there can be viral eczema that shows up. And as well, when we look at hives in an IgE reaction, sometimes hives can happen with non-IgE reactions as well. They are just delayed. So we need to be able to differentiate that as well. What kind of skin presentation is happening? There are lots of other skin presentations that happen that we need to differentiate. And often, again, it is food triggered. So certain foods, but also chemicals can trigger eczema. Toxins can trigger eczema. And it's a sign that you need detoxification support. Very, very much so. When things are, one of the ways that our body detoxifies is through the skin. And in my mind, it's almost a last resort. So if our other detoxification pathways are not working well and it's showing up on our skin, then it means we need to work on detoxification. We need to support our detoxification organs. We need to open our pathways, and we need to focus on that. I want to mention colic. So again, for those who have little ones and babies, when a baby is screaming for hours a day, it is not just a phase. This is a symptom. This is a sign of pain. There's something going on. And yes, babies cry. Crying and screaming for hours and hours a day is different. As a mom or a caregiver, you probably know the difference in your heart and in your body when it happens. So with colic, it is just a symptom. That's where I work closely with moms and caregivers to look at the whole history, all the signs and symptoms, and create a plan specific for that little one. Now, I did want to mention that sometimes some people have a mixed presentation of IgE symptoms and non-IgE symptoms in one reaction. That can happen. What that means is that multiple parts of the immune system are being triggered at once. So as we go through this, you can see there's lots of different labels. We're going to go into a couple more differential diagnoses in a moment. And I also want you to know that there are other GI conditions as well that I'll be going more in depth on during the digestive and GI masterclass. So again, make sure you subscribe to the full series to get access to that. Just put series in the comments and I'll get you the link. So now I want to take a moment to address things like CMPA, cow's milk protein allergy. Now, this is important to note that CMPA can present in any of the above signs and symptoms and presentations. And this is where it gets tricky. This is why sometimes in the allergy world, I think there's too many labels, because all CMPA means is that you're reacting to cow's milk. So you can have eczema from it. You can have digestive issues from it. You can go into anaphylaxis from it. You can have diarrhea from it. You can have all sorts of different things. So this is just a label saying that it's cow's milk, which is the trigger, but it doesn't say anything about how it presents person to person, and it presents very differently person to person or child to child. MSPI is another one. What this stands for is milk soy protein intolerance. Again, this is a misnomer because it's not an intolerance. We're not working with enzymes here. We're talking about an allergy. Typically, and again, it can be an IgE allergy or a non-IgE allergy. So all it means is that milk and soy are creating reactions. And now the protein part in this, just like earlier in the FPIs and the FPIAP, it's not just food proteins. You can have a reaction to a food derivative, to an oil, to a fat. It's not just protein, which is important to mention as well. So again, MSPI is just a label that it's milk and soy that you're reacting to, but it says nothing about the actual presentation. MFPI is another term that goes around, which is a multiple food protein intolerance. Again, not an intolerance, it's an allergy. And we are talking about just multiple foods create a reaction. We don't know which ones. Celiac disease is another one that I really want to mention because this has special considerations. So celiac disease is an autoimmune condition to the gluten protein. So when you consume anything with gluten, it can be wheat, it can be barley, other grains as well. That's the word I was looking for. So when you consume any kind of gluten, your body goes into an autoimmune reaction. So not only does it see the gluten as an invader, it starts attacking yourself. And with celiac disease, there are different blood markers that we look for. So labs are very important to get with celiac disease to specifically diagnose that. And there is an endoscopy that you can do as well, where they look at your colon and your intestines to see if there are signs of celiac disease there. Again, with celiac disease, it is autoimmune and healing can occur. That's important to mention. One of the other things that I want to say is that if you feel that you have a challenge digesting gluten or you have symptoms with gluten, it is really important to get the lab work before you eliminate gluten. The reason why is because then the lab work and potentially the endoscopy is not going to be accurate if you're not consuming gluten on a regular basis. So that's one of the mistakes that I made early on. And myself personally, I still live as a celiac. And I have a question mark because I was eliminating gluten for too long already before I went and got testing. So regardless, I want you to know that we need to do the lab work first. That's something that I can work with you to make sure that you get the appropriate lab work. And at the same time, we can still work with autoimmune diseases. Even with celiac disease, we can heal and seal leaky gut. We can rebuild the microbiome, and we can experience healing and health and transform our lives. One other piece that I want to mention with celiac is the special considerations are that we have to be extremely careful about trace amounts and cross-contamination with gluten. You need to be aware of personal products, restaurants specifically. There are specific coaching that I give for eating out, for eating at other people's homes, etc. And that is, again, where the support is really important. All right, we're getting to the end here. The last one that I want to mention is oral allergy syndrome. So this is a pollen food syndrome. It's a hypersensitivity that is to certain raw fruits and vegetables and nuts, and it typically occurs in people who have pollen allergies. So this is a cross-reactivity. So with pollen food syndrome, people who have pollen food syndrome can tolerate fruit and vegetables when they're well cooked. So this is a kind of caveat, something that is not well known, but I actually personally know a whole bunch of people who have it as well. So I just wanted to mention that as well. And that's one of the ways that you can decode your body. If you have a reaction when you eat something raw, if you cook it and you don't have the reaction, that's a sign that it is more than likely oral allergy syndrome. All right. So it may be confusing with all of these overlapping labels, right? And I don't want you to get attached and identify as a label as well, because like I mentioned, the root causes are all the same. And it is important to work with those root causes for healing and resolution and improvement, and also know how to navigate and support your body and create a plan that's custom and specific to you. So when I work with clients, again, we're going to go through all the pillars in just a minute. We work on holistic nutrition, integrative detoxification, gut health, emotional energetics, nervous system regulation, and decoding the body. So like I mentioned with all the other ones, we need to, even with non-IgE allergies, a little bit does hurt. We can't expose ourselves and keep exposing ourselves, because even with trace amounts, we are creating inflammation. We're creating inflammation. It is increasing our likelihood for more reactions. It is increasing our leaky gut, which is causing more food allergies and autoimmunity, pain, discomfort, and more. Even with non-IgE allergies, we need to read labels. We need to look at derivatives in products. We need to know how to call companies, know what to ask for. We need to know how to advocate for ourselves in restaurants. We need to know how to talk to our children about this. And we need to be able to learn what are our root causes. What is it that's specific to us? And how do we work with that? What is our body trying to communicate with us is out of alignment. So again, I have the course that's specific to dairy, but it teaches you how to read food labels, how to look at derivatives, how to understand what it is as far as communicating our needs about allergies and how to navigate them in our world. So go ahead and put course in the comments if that is applicable to you. And then again, I coach on all the allergens, because any food can be an allergen. And again, myself personally, I've been down to a 2-food elimination diet, so I know what to look out for. I did want to mention the top 14 allergies, just because some of these are a little unexpected, but they are important. So celery is a top 14 allergy. Again, gluten, so things like wheat and barley and oats. Crustaceans, so seafood, right? Prawns and crabs and lobster. Eggs, fish. Lupin is another unexpected one. Milk products, mollusks like mussels and oysters. Mustard is another unexpected one. Peanuts, sesame, soybeans, sulfur dioxide and sulfites. and then tree nuts. So these include almonds, hazelnuts, walnuts, Brazil nuts, cashews, pecans, pistachios, and macadamia nuts. Now, again, it can be a little confusing because you can tolerate 1 or 2 or 3 different kinds of nuts, but you may not tolerate the 4th nut. So that's where, again, we need to be really aware of cross-contamination and how do we create a plan to keep you safe or your little ones safe as well. Again, non-IgE allergies can start at any time. When we look at the root causes and we work with the root causes, that's how we can start resolving them and healing them. You can have a non-IgE allergy develop after multiple exposures to a food. Reactions may vary from time to time, so you may have a different reaction one day and a different reaction the next day, and you need a plan. So especially if, again, having a medical emergency plan in place is crucial. Having a school plan in place is crucial. For social events, for travel, having a plan in place, knowing how to communicate it. And again, for school, I consult for 504 medical plans. So I help you make sure that you have the most appropriate and comprehensive plan for your child as they go on to daycare or school, whatever. I also consult with school systems on this as well. So throughout all of these food allergies, the immune system and gut health are crucial. And this is a large mechanism of action, right? So put 1 in the comments if you've gotten clarity and a deeper understanding of food allergies so far. Put a 1 in the comments if you have had an aha moment where you started connecting the dots of the different signs and symptoms or your presentation, or maybe the labels, you got some clarity on that. Put a 1 in the comments if that made a difference for you. And again, share this with someone you know is going to benefit from this information as well, whether it is a family member, a friend, a school system, a teacher, let them know. So again, if you feel comfortable, share in the comments which one you think you have or your child has based on the signs and symptoms that they're presenting. And you can just put the category. Is it IgE allergy, a non-IgE allergy, or an intolerance? Or are you not sure? Go ahead and put not sure in the comments. That's okay too. And again, if this approach that I'm presenting to you with the Radiant Health Protocol resonates with you, and this level of care that I provide is something that you need and you want on your journey, you want a practitioner who's going to listen to you, who's going to work with you, and you want to address the underlying root causes of food allergies to heal and see improvement with confidence, clarity, and calm on your journey, go ahead and put Radiant in the comments, click below, and get the discounted package of support with a month of support today. So I did want to add a few other pieces before we jump into the pillars. And we're going to start with breastfeeding because, again, that's such a subspecialty of mine. And I just want you to know that not all babies react through breast milk. So if you were breastfeeding and you were eating all the things and your baby did fine, that's great. And sometimes they may react when they start getting solid foods. Some babies, though, like I personally experienced, do react through breast milk and solids as well. So we need to make sure that we have a plan set in place, especially if they're already reacting through breast milk for solid introduction. And if you are suspecting it or your baby starts having reactions, then we need to have a plan on how to proceed forward as well. And again, you can react to any food, to any ingredient, to any derivative, to any oil. It doesn't have to be a protein. Even trace amounts, even cross-contamination can create a reaction. Again, sometimes these presentations are mistaken for a GI bug, food poisoning. You know yourself and you know your child. If you are seeing a pattern, if this is something that's repeated, or if you're just seeing signs and symptoms and you're curious, reach out. We can work together to see and get clarity about what you're experiencing and what's going to be the best plan for you. Now, I did want to mention one of the contributing factors now, and I'm going to mention more as we go through, but genetics plays a part in this as well. So I often get asked, are food allergies genetic? Yes and no is my answer. So yes, there is a genetic predisposition to food allergies. And at the same time, no, because it's not a guarantee that if you have food allergies, that your child will have food allergies. There is also something called epigenetics. And this is a study of research where they look at experiences and how that affects your genetics, how that affects your presentation. So that is really important to note as well, because when we are looking at this, we need to take part into account our diet, our lifestyle, how that is potentially activating and changing the expression of our DNA and genetics. That's equally as important. So we're going to go through more contributing factors now, and we're going to talk about the underlying root causes and what we can do with them, because that's where the epigenetic piece comes in. That's the empowerment piece, is you may have the genetics for something and you can do something about it. And you're empowered to look at the underlying root causes and work with them. So this is the Radiant Health Protocol, these 6 pillars. And keep listening afterwards, because we'll bust some more myths and answer frequently asked questions as well. All right, so welcome back. This is part 2 of the Food Allergies and Intolerances Masterclass, and my name is Dr. Beata. If you haven't seen the first part, go ahead and click the link below. Make sure you watch the first part where we explain what food allergies are, the different kinds, we look at signs and symptoms, and we go in depth on the multiple different categories. The 3 that I focus on are IgE-mediated allergies, non-IgE-mediated allergies, and food intolerances. So make sure you go back and watch that one as well. So what we're going to do now is we're going to dive deep into the 6 pillars of the Radiant Health Protocol. And this is where the healing happens. These are the underlying root causes of food allergies and intolerances and any other health conditions. So the first one I want to present is holistic nutrition and nourishment, because with food allergies and intolerances, food is the focus. The first part is identifying the foods that are creating the reactions. What is it that our body is not able to digest? What is the immune system reacting to? Okay, so we need to identify those foods, we need to remove those foods, and all exposure. And again, like I mentioned earlier, sometimes that is in personal products, sometimes that is in trace amounts and cross-contamination. So we need to be able to work through that, and that's what I'm here for. And inflammation and activation of the immune system happens when we have this exposure. So when we have this exposure, it is literally activating our immune system even further, making us more likely to have more food allergies, more inflammation, more signs and symptoms or conditions show up in different ways. And again, I am here to help you figure this out, to work through the process, and at the same time, not make your life more stressful than it needs to be. So I also have an elimination tracker that has ways that you can start tracking your food to start identifying what it is that can be causing a reaction for you, especially if you have those non-IgE-mediated allergies that are a little bit more difficult to figure out and a little bit more tricky. And then again, I'm here for one-on-one guidance and support as well. Because when I first started on this journey, I jumped into a major elimination diet. And again, with breastfeeding, that adds another component to the complexity of it. And now, after looking back, there are ways to do it differently. We don't need to deprive ourselves more than we need to. And we also need to focus on nourishment. So when I work with clients, we make sure that we identify those triggers and we remove them. And at the same time, how do we focus on what it is that we're actually eating? How do we ensure that you're getting the proper nourishment for your body to function, even with limited ingredients? Because I want to remind you that myself and my daughter, we have been some of the most sensitive ones that I've come across and our practitioners before came across. We were down to a 2-food elimination diet at one point. So we have done it. And through that process, I've learned how to nourish our bodies effectively and optimally, even with limited ingredients. I work with that very sensitive population and I can help. And again, the next pieces are, how do we optimize digestion for absorption and utilization of these vitamins and minerals? Because we can be eating all of these amazing things, but if we're not able to digest them, then they're not going to do us any good. And again, how are we preparing and cooking our food? This is something that most people don't think about, but it matters. It can improve our digestion and the nourishment that we're able to use. So when we work together, I work with you to create a nourishing plan so that you feel confident knowing what to eat and how to manage social situations, going out, etc. You get a custom guidance for you and your situation. And again, if it's a baby that you're watching this masterclass for, the breastfeeding mother's diet or formula that they're having is important to be able to recognize what's happening, how to modify it, when to change things. How to wean baby to solids is really important as well, because some children do start showing signs of food allergies through breast milk or formula, and others don't. But if they do start showing signs, we need to be able to support them and have a plan for how to introduce them to solids. And again, comment solids because I have a resource specifically for that, just for the general population as well. And again, we identify food allergies with various methods, which we'll go into later in the Decoding the Body section. And we decrease inflammation. We allow healing to occur. I focus on whole foods as much as possible. Food is so powerful in healing when we know how to use it. And when I work with clients, we look at different ways to trial, unique tracking methods without becoming obsessive, how and when to trial, and how to reintroduce foods, when to reintroduce foods. All of this requires unique and customized solutions. And then again, an oral food challenge is really the gold standard and the only way to know if a food is creating a reaction or not. So we look at oral food challenges with the IgE allergies. Like I mentioned earlier, you need to be working with an allergist to do in-office trials and challenges with medical supervision. And I still can guide you on that process as well. And especially for those with intolerances and non-IgE allergies, we do our trials and challenges at home for the most part. And especially, again, if there's no signs of medical emergency or hypovolemic shock, I guide you through that process, how to do it safely, how to do it, again, effectively, and how to sometimes get food in your child or your baby if they don't want to eat it as well. I have lots of tips for that. So what if I could teach you how to use real food to support your body, your child's body, for optimal health? Not supplements, not medication, just supporting your body with its innate wisdom and the nourishment that we provide it. How would that feel? How would it feel to have confidence and calm and clarity, knowing what to eliminate, what to add into your diet, and how to proceed and move forward? How would that change your life? And what would become possible for you? What would become possible for you instead of hours online researching or waiting weeks for appointments? What if we knew how to also nourish our body with movement? Movement is really crucial on any healing journey, and even with food allergies. Nature exposure, healthy, supportive, nourishing movement. Those are things we work with as well. And again, for adults, caregivers of little ones who with food allergies, we need to look at how we're nourishing our mind with the thoughts that we think, what we focus on, how we speak to ourselves, what beliefs are we holding on to, and more. How are we nourishing our souls? Are we expressing our creativity? Are we connecting with our higher power, with the divine? What state are we in the majority of the time? Is it stress and anger and frustration, anxiety or fear? Or are we experiencing grace and forgiveness and gratitude and compassion and flow and ease and love on a regular basis? We need to be aware of our environment, how that's affecting us, our relationships, our family dynamics, our business or our career. All of these add to our holistic nourishment. And our babies and kids can feel our energy. They know when we're stressed, when we're not being present with them, And this increases the states of dysregulation within them as well. And as moms and dads and caregivers, we get the opportunity to heal right alongside with our child. How we are nourishing ourselves is just as important, and it doesn't take a lot of time. I use quick strategies that even as a sleep-deprived, busy mom, working in and out of the home, and now a single mom, business owner, I've been able to incorporate, and you learn how to incorporate them into your daily experience without it being an extra thing to check off your list. It becomes your identity and it becomes your being. This transforms you. This transforms your family and it transforms your life. This goes way beyond health. And this root cause is crucial for food allergies. Have you only been focusing on food so far? And that's okay if you have, because that is the focus for the majority of us. So one quick food-focused tip that I want to give you is to take a look at the food that you are eating, and especially the processed foods. So anything in a bag, a can, a box, and just flip it over and look at the actual ingredients. It doesn't matter what the front may say, right? And so again, for allergies, we may be looking for dairy-free foods or gluten-free foods or whatever it may be. And what is the product actually made of? Because many processed foods are fortified. They have chemicals, they have additives, they have preservatives, all things that actually increase the inflammation in our body and increase the toxic load in our body. So I, again, like to go with whole foods, organic food, high quality animal products, nourishing foods, instead of the packaged stuff. Now, are there some snacks that we have that are packaged? Yes, but when I recommend these, they are the highest quality ones that I've been able to find, because we need to make sure that we're not actually working against ourselves with nourishment by increasing our toxic load with these preservatives and additives and chemicals and fortified foods. Our body's not able to actually absorb them. And I talk more about this in the Holistic Nutrition and Nourishment Masterclass specifically. So again, make sure that you put series in the comments to get that link to sign up for the full the full series. So this may be new for some of you, and that's okay. Put a 1 in the comments if that's new for you, looking at food this way and recognizing how much of an impact food has on our nourishment. Again, we're all in different phases of our journey, and where it's perfect, divinely perfect, exactly where we are. So again, put series in the comments if this is an area that's alive for you and you recognize that you need to work on this and you need some support on this. And again, I'll send you the masterclass link. The series is absolutely free. And then there are those of you who are ready to experience nourishment on all levels, who are ready to get to the root causes and address them of food allergies and intolerances, who are ready to heal and get resolution of signs and symptoms. Click below for the special full month support package that's 89% off of the regular price, and get customized solutions for your food allergy and intolerance journey today. So the second pillar that we're going to go into now is integrative detoxification. This is not a one-off detox or a cleanse. That's not what we're talking about. We're discovering how to work with our body as our ally, how to open our innate detox pathways, how to support our detox organs, and how to understand the interplay with emotions and energetics and the nervous system on a holistic mind, body, and soul approach and levels. So when we think of food allergies, right, we have, that is a sign that our body's communicating with us that something is out of alignment. Our immune system is hyperactive. It is being easily triggered. That means that we have a high toxic load. That means that more than likely our detox pathways are congested. When we talk about detox pathways, there's multiple of them. We talk about our colon, our liver and gallbladder, our lungs, our skin, our lymphatics. One tip that I can give you right now is that you need to be pooping daily, having a full bowel movement every day. If you're not, that means that detox pathway is clogged. And therefore, toxins are not able to leave. So what that does is those toxins are recirculating. They get literally reabsorbed through that wall, the intestinal wall, into your bloodstream. And they are increasing the inflammation in your body, making your immune system more reactive, making you more susceptible to be even more sensitive and have more food allergies. So we need to be having a full bowel movement daily, and that includes babies and children as well. Now, when you think about toxins in our environment, in our modern lives, they are all around us. The average person is exposed to 700 toxic chemicals on a daily basis. So let's be aware and have agency and empowerment over what we can change. Let's look at our personal products that we use in the morning. What are some changes that we can make? What are some replacements that we can use? These are all things that I coach on depending, again, on your specific needs. And again, toxin exposure, I don't want to scare you because our body, again, has these natural innate detoxification pathways, and it knows how to do this. Our body's made to detoxify. Let's just support it. Let's look also at our environment, at how many non-organic foods are we eating, because glyphosate or Roundup exposure affects our gut health significantly. It creates leaky gut, and it increases the toxic load that literally creates havoc throughout our body. And then not only does our body have to fight that off, it also has to work hard to detoxify it. Another toxin that many don't think of is actually vaccination. So with vaccines, there is toxic load. They have heavy metals in them. They have different toxins and chemicals and preservatives. This can activate the immune system, and it can limit our detox pathways. So some families that I've worked with, and many actually, have seen an increase in allergies or a beginning of their allergy journey after vaccination. So again, this is such an important piece that you need support and guidance on if this resonates with you, if you identify with this. Next is, again, medications. Whenever we use a medication, that actually has chemicals, preservatives in there as well. I don't prescribe medication. That's why those who do need an EpiPen need to work with an allergist. And when we look at the root causes, no matter what the symptoms are, no matter if it is IgE, non-IgE, or food intolerances, right? And no matter if it's presenting as digestive or skin or respiratory or swelling or cardiovascular or even shock or anaphylaxis, a holistic and natural approach will address the root causes and ultimately reverse symptoms. Because again, medications have a toxic load with them, supplements do too. This is something that many don't recognize, but just because something is a supplement does not mean it is clean. Many of the supplements that I get requested to participate in their program or whatnot, I look at and I don't, because there are so many chemicals and additives and preservatives in the ingredients. It can be a toxic load. And that's why I work with whole food as much as possible. Occasionally, is there a supplement or two that I recommend depending on the situation? Yes. And it's not something that I want you to take forever, because we work with your body to no longer need it. And at the same time, any supplement that I recommend is going to be the highest quality, the cleanest that I have come across and that I've been able to find. So this is so important to me, because when we work together, you don't have hundreds of dollars of supplements to buy each month. And I also did a whole video explaining this downfall of supplements that many don't know of. So put supplements in the comments and I'll get you that video specifically. And again, does this make sense? So when we hold on to toxins, when we have an excess amount of toxins in our body and we're not able to detoxify them, it increases the inflammation throughout our body. We become more reactive with the immune system, which turns out into more food allergies, more sensitivity. Put a 1 in the comments if that makes sense. So in the Radiant Health and Wellness Live program, we have 8 different modules and pathways that we work with. Some of those, again, like I mentioned, are the colon, the liver and gallbladder, the lungs, the skin, the lymphatic system. We need to make sure that all of those are working optimally for detoxification and for health and resolution of signs and symptoms. Now, some people talk about parasites and heavy metals and candida. Yes, those are things that we absolutely need to pay attention to, and doing a harsh parasite cleanse or a heavy metal cleanse without doing the proper work beforehand is actually going to be more detrimental for you. Because when we support our detoxification pathways, when we work on gut health and holistic nutrition and all of the other components, our body is actually able to detoxify these naturally. And especially with sensitive little ones, we don't want to put them on these harsh protocols. Their little bodies cannot handle it. So have you ever experienced this where you've gone on a detox and then you've actually felt worse? The reason why is because your detoxification pathways were not open. So when you do one of these harsh cleanses or, parasite cleanse or candida cleanse or heavy metal chelation, let's say, for example, if you don't know how to support your body optimally so that those heavy metals make it all the way out your body and get eliminated, if you don't do that, then what they do is they literally are now in circulation. Your body works really hard to contain them, and now you're exposing them. You're letting them work around and move through your body, and they're actually going to create more inflammation. They're going to create more damage and harm that way. So with detoxification, I use a very different approach. We need to support your body well. We need to make sure all the functions are working. And then we work through some of the more serious detoxification protocols. We need to prepare your body for it. That is so important and something that most people don't talk about, especially the people that are selling the detox pills or the detox spray or whatever it may be. So detoxification is a crucial root cause for how reactive our immune system is, how congested or clogged up our detoxification pathways are. And at the same time, let's talk about emotions and energies. When we have stagnant energy or trapped emotion, when we have frequency that is not aligned, when we have negative energies in our homes and within our fields, that is going to manifest into physical stagnation and physical blocks. And when we carry limiting beliefs around and old wounds and traumas that need to heal and need to be integrated, we need to be paying attention to that too and how it's showing up in our physical body and the physical signs and symptoms that we have. It's not just about the physical body. We need to look at our environment, our relationships, our career, and our business. Sometimes we need to detoxify certain aspects or things of that. When I work with you, we work on physical, emotional, mental, energetic, spiritual levels. Detox on all levels. And one of the ways that I bring this to many of you is the Holistic Detox Mini Retreat. We just had one last week. Comment retreat if you'd like to learn more about that. That's where we go in depth on this process and we start to really bring consciousness to what is no longer in alignment with us, what is no longer for us, and how do we lovingly let it go and release. So again, if detoxification is something that you're recognizing you haven't done much with on your journey, you need support with, put series in the comments and I'll get you the full masterclass series. It's free and you'll get that video on holistic detoxification and integrative detoxification so you can start using it today and start transforming your health today. And if you're ready to go deep, support your detoxification, get to the root causes of your signs and symptoms, your food allergies, your food intolerances, you're ready to heal and reverse your presentation, go ahead, click below, get 89% off of a full month of support, and put Radiant in the comments as well, and I'll give you the information for that. And I also just want to pause and speak to the practitioners that are watching this as well, or people who want to become practitioners. We've only gone through 2 pillars, and can you feel how transformative they are already? If this is something that you want to get certified in, if as a practitioner you want this mentorship and this continued education and experience in, put practitioner in the comments and I'll get you information about the mentorship And in the masterclass series, there are videos that are specifically for practitioners as well. So make sure you sign up there. All right, we're going now to the third pillar, comprehensive gut health and healing. Gut health affects everything. This is the cornerstone of our health. It is a mechanism of action and a huge root cause for food allergies and intolerances. Hippocrates said that all disease begins in the gut. This is ancient wisdom that has proven to be true, and it does affect every process in the body. When we talk about the gut, I talk about a condition called leaky gut, that if you have food allergies or intolerances, you also have leaky gut. And many other health conditions, the root cause is leaky gut. What this is that when we have our gut wall, there's a lining, and there are small spaces in that lining where as food gets digested, as it gets into our digestive system, there's bacteria, there's viruses, parasites, all sorts of things in there. When those spaces are normal, when they're appropriate, then those particles of digested food pass through into our bloodstream, into our lymphatics, and they circulate through our body and get used through our body. However, when we have leaky gut, what happens is that lining loses its integrity. The spaces now become larger. And now things get into our bloodstream and lymphatics that shouldn't be there in the first place. So one, with digestion, if our digestion isn't optimal, then particles and complexes of food that are too big are getting into our bloodstream and lymphatics that have been not digested properly. Those cause inflammation and reactivity in the immune system, which creates food allergies. We talked about food intolerances, how the lack of enzymes doesn't allow you to digest well. So if that's happening, guess what kind of food particles are ending up for absorption? Ones that are too big. And like I mentioned, when those spaces are too big, now bacteria, viruses, parasites, toxins, chemicals are now entering our bloodstream and lymphatic system for circulation. This is how the immune system gets triggered. This is how we get overreactive. This is things like when I talked about MCAS, mast cell activation syndrome. This is what's happening. We need to look at leaky gut, because when that food particle comes into the bloodstream, inflammation is created and it triggers an immune response. So when I work with clients, we look at digestion, right? How do we optimize our digestion? All the steps of the digestion process. How do we break down food particles? And then we look at our gut microbiome, which is a collection of trillions of cells. And I'm sorry, not even cells, they're microorganisms. So there are bacteria, they are viruses, there are fungi, there are parasites, there are yeasts, and probably many others that we haven't even discovered yet. All of this works in symbiosis. What that means is when it's in harmony, everything has its place and everything functions well and works well. The problem is when something becomes overgrown. So have you ever heard of a candida overgrowth, right? Or parasite overgrowth if we have parasite issues. It means that that becomes out of alignment from that natural balance and harmony based on what's happening in our body, our toxicity levels, our nourishment, our gut health. And when that microbiome shifts, then it creates more loss of integrity of that gut wall. This affects everything. So way beyond digestion. This affects our mental clarity. This affects our emotional states. This affects our energy levels. This affects our connection to the divine and spirituality. This affects our skin. This affects absolutely everything. And so a question I often get is, do probiotics help? My answer is sometimes they do and sometimes they don't. Just probiotics alone are not enough for gut health. This is not going to heal a leaky gut. It is not going to rebalance your microbiome just by taking a probiotic. It's a good step, but that's not all there is to it. We need to go beyond supplements or probiotics when we look at gut health. We need to nurture our gut microbiome with real whole food. We need to heal and seal the gut wall. We need to support optimal digestion. This is a cornerstone of health. And our gut is literally a pharmacy that creates and secretes hormones. It affects our metabolism. It affects our immunity. It affects our inflammation levels. Like I mentioned, it affects our mental and emotional states. And then there's the gut-brain axis. So this is via the vagus nerve, and it affects our mental and emotional health. So oftentimes with food allergies or intolerances, there are related mental health conditions, such as sensory processing disorder, autism, ADHD, OCD, anxiety, depression, eating disorders, schizophrenia. There are multiple conditions that are associated with food allergies and vice versa. Those that have these mental health conditions are often present with food allergies and intolerances. It is one in the same. Gut health is just one component, but when you combine it with all of the pillars of the Radiant Health Protocol and you work holistically, the transformation is remarkable. And then we look at the energies and the emotions that are associated with certain pathogen overgrowth. So a candida overgrowth is going to have an emotion related to it, an energy, a frequency related to that, a geometry related to that, compared to a parasite overgrowth. Healing leaky gut and optimizing the microbiome and optimizing digestion is crucial and a vital piece of your journey with food allergies and intolerances and healing them. Taking supplements and medication long-term is not going to do that. It's not going to get to the root causes. And at the same time, using fiber or celery juicing to have bowel movements, those are not addressing the root causes either. We need to address the toxin load. We need to heal leaky gut. We need to optimize our digestion. We need to nourish ourselves holistically. We don't want to look at temporary fixes and Band-Aid solutions. We need to focus on root causes. And some contributing factors to this, the gut health, are also antibiotics. So some of us, there are places where you do need to take antibiotics. And oftentimes, they're not necessarily needed. So limit your antibiotic use to only when it is absolutely necessary. Antibiotics destroy gut health. They destroy that balance and harmony. They allow opportunistic bacteria and yeasts to overgrow much faster. So when you do need to take antibiotics, we can work together to support your gut health during the course of antibiotics and after. And ideally, we can work to avoid them in the first place. We need to rebuild our gut health for 3 months after every single antibiotic exposure. So again, when I work with clients, I create specific custom protocols for their phase of their journey, whether you're just starting out with gut health, whether you just got off a round of antibiotics, or whether you've been eating clean and working on certain aspects of gut health yourself with probiotics and other things. So again, put series in the comments if gut health is an area that you need to focus on. I'll send you the link for the whole masterclass series, and you'll get the specific gut health masterclass in there as well. And if you are ready to experience optimal digestion, reap all the benefits of healing your gut, and get to the root causes of food allergies and intolerances for healing and resolution, click below for the special full month of support package at 89% off right now, and get custom solutions to activate your radiant health, wellness, and vitality. Fourth pillar that we're going over today is nervous system regulation. When we're in a stressed or worried state, our nervous system shifts and we cannot heal. Physiologically, it's not possible. Same thing when our babies or children are in distress. When we're in this state, we're in fight or flight. We're in survival mode. When we're stuck there, we can't move into rest and digest mode. Healing cannot occur. Regular body processes don't function, including digestion, detoxification, metabolism, hormone production, etc. It throws everything off. And what happens is we may be eating all of this wonderful organic food. We may be taking supplements. We may be even doing yoga classes and meditating. But if we're in fight or flight the majority of the time, all of that isn't doing you any good. Your body's not able to utilize the goodness, and your body can't receive it. It can't access its innate wisdom, heal, and maintain health. Remember what we said about optimal digestion? The nervous system affects that. It affects enzyme production. It affects enzyme secretion. It affects stomach acid levels. It affects our gut health. Nervous system regulation is crucial to all of our physiologic processes, in addition to our emotional and mental states. We need to shift out of fight or flight and into rest and digest as often as possible, and help our children as well on this healing journey. The vagus nerve and vagal tone is a huge aspect of this, and is how gut health interplays directly with our nervous system. So the vagus nerve is a wandering nerve, and it's a cranial nerve, so it starts at the top and it goes to all of our organs and directly into our gut. So the information that it's getting from there, it's sending back up, and it's affecting our emotional and mental states. Again, that gut-brain axis. So for many conditions, this is a huge root cause, because when we're in fight or flight, our body is sensing that we are not safe. There is a feeling of unsafety. And this emotion is the underlying root cause for food allergies, for food intolerances, for anything where our immune system is hyper-reactive. As adults, all of us have experienced some level of childhood wounds or traumas. For some, it may have been something small. For some, it may have been big, like abuse or neglect. And even when I say small, I mean that in a very validating sense, because something quote unquote small can have a huge impact on us. And this is something that I've gone through personally. And as someone who coaches parents, this is where I see such a profound effect in learning this as a parent, because now you can parent your children differently so that they don't have these experiences as well. Because when we experience these things that are traumatic, they are wounds, they literally rewire our nervous system to be more prone to fight or flight. And this continues throughout our lives into adulthood. So therefore, it makes us more prone and likely to have medical conditions. This is an epidemic that no one is talking about, because it doesn't just show up as food allergies. It shows up as heart disease. It shows up as cancer. It shows up as diabetes. It shows up as a whole list of things, hypertension, etc. And this is not just me saying this. And autoimmunity is another big one I forgot to mention in that list. This is not just me saying this. This is supported by research, by a study called the ACEs study by Kaiser Permanente. What they did is they surveyed, I forget how many people, but it was thousands of people, and got their responses based on how many of these traumatic events have you experienced in your life. And I just realized that my microphone was down there. So you'll be able to hear me much better now. So with this study, they then correlated over years the medical conditions and presentations that these people have had. And when you sign up for the full masterclass series, you'll get a specific resource that will help you assess your own ACEs score and start, again, putting the dots together, understanding your journey. This is the underlying root cause that shifts everything when we address it. And again, make sure you sign up for the full masterclass series, put series in the comments, If this is resonating with you, if you haven't thought of this before and you need support with this, the free masterclass series has a whole video just on this. And I often get asked, well, what if it's a baby? Are they just, how does their nervous system get dysregulated? So even babies can have experiences like a birth trauma. They can have experiences in the womb. They experience the stress and the emotions that the mom is feeling during pregnancy and before. And there's, again, I mentioned epigenetics earlier. So we can have trauma passed down through generations through epigenetics and our energetic blueprints from our ancestors and from generations before. So these energies and emotions of our ancestors can be coded into a baby. And I work with parents to help regulate their little ones. And there are techniques that I teach that you can use to regulate yourself and then co-regulate with your child and to regulate them directly. This is something that no one talks about in the food allergy world, and it makes such a huge difference. This was when our personal journey, everything changed. When we regulate our nervous system, inflammation goes down, our digestion improves, our hormone balance improves, our immunity improves, our mental and emotional states improve. It is all related. So again, put series in the comments for the full free masterclass series and get the specific training on nervous system regulation and the resource for the ACEs study. And if you're ready to experience nervous system regulation finally, if you're ready to address the root causes of food allergies and intolerances, heal and resolve signs and symptoms, click below, get 89% off for a limited time of the full month of support with a consultation, resources, custom solutions for your journey. Okay, we're on to pillar number 5, emotional energetics and spiritual alignment. So I want to give some examples because they are so profound and it's going to help you understand this pillar. So just the other day, we were having a call in our live program and participants and members were sharing about apologizing that they were crying during the session. And I shared something that I found from my childhood where I was proud that I did not cry for 2 years as a child. Now, this was from conditioning. This was from my upbringing where I was constantly told that it wasn't okay to cry. And this person was apologizing as an adult for crying in a space where it was okay to cry. There's lots of tears that end up happening during the emotional healing process. It's cathartic, and it's important to be able to cry when you need to and to release. But as children, if we internalize, if we learn that it's not okay to cry, that it's not okay to express our emotions, that we're only quote unquote good when we're happy, when we're compliant, when we do as we're told, we begin to internalize our emotional experience and the energies of those emotions live within us today. We trap those emotions in our body. And the emotions and energies of those emotions manifest as physical disease. They create blocks of energy and stagnant energy. And when we look at our lifespan, if we started as children who were taught that it was not okay to cry, how many years have we been suppressing and repressing our emotions? How many years of trapped emotions live within us? This is an opportunity for you to bring that to consciousness and to allow yourself and give yourself permission to feel and process and integrate those emotions. I do this in a safe space. I'm a trauma-informed practitioner. So you don't have to be re-traumatized. We don't have to go back and re-experience things. And for radiant health and wellness, we need to process those emotions that are living within us and that have been trapped there for way too long. Because over and over again, I work with clients who have had decades of digestive challenges, autoimmunity, food allergies, and we start working through the emotions and the energies, and they literally feel a change in their body. They see a change in their body, in their physiology. As we integrate, they feel a distinct release. Symptoms improve. Sometimes this takes multiple sessions, different techniques. Sometimes it happens very quickly and profoundly. But the energies and emotions living in the body are one of the root causes of food allergies and intolerances. That's why the presentation is different in each person and to different degrees. Depends what we've experienced and how we've internalized it. And there are techniques that I teach you and you can use for your children and your babies as well. And I teach you how to teach your children. That's where we make the greatest impact. That's how we transform generations. And we gain this understanding that emotions can manifest in physical and mental conditions. And by integrating and processing the energies of these emotions, we are freed up for optimal health, vitality, and well-being, for radiance. The emotions and the frequencies of those emotions, when they become trapped in our body, create stagnation, pain, symptoms, profound mental and emotional effects, and they are the underlying root cause of our presentation. And again, how do we get these trapped emotions? With that nervous system regulation component, this is where it all integrates. When we get unsafety passed down through our generations, through our epigenetics, through our energetic blueprints from our ancestors, the energies and the emotions of that experience, it lives within us. So how many of our ancestors have been involved in a war, have been discriminated against, have had horrific things happen to them or seen horrific things? That lives within us even now. And we have agency because we can work with that and we can integrate it and we can release it lovingly. This is again where that holistic detox piece integrates in. It's all connected. It's all quantum. It's all one big giant web. And we have to work with all of these pillars in conjunction to get results, to get change. And again, babies, they pick up on our energies, our emotions. If there's conflict in the home, if the mom is holding resentment or anger or anxiety or sadness. And there are various strategies that as caregivers, we can use to move this energy and integrate it even for our babies and our little ones. So again, for adults, we may be thinking, well, no, I didn't really experience any trauma. And, I say childhood, but we can experience traumas and wounds through our teenage years, through adulthood as well. But maybe you're sitting here like, no, I've had a pretty good life. Like there wasn't really anything that traumatic that happened. Sometimes we experience things as children and we're not able to process the strong and emotionally extremely scary emotions that came up because it feels like a threat to our survival when we're little. This goes into attachment even, the reliance on our parents and caregivers. So as children, we may actually disassociate. We may suppress and repress certain experiences that we had because they were too painful. We may downplay something. And that's why sometimes Many of us don't even remember these things. But when these emotions are not processed fully, they become stuck in our field. And again, children, even babies, are very intuitive, and they can pick up on this, and they can hold on to them. They can hold on to our energies and emotions. And again, this happens beyond childhood and teenage years and adult years. So just think back to how often you were told not to cry as a child, that it's not okay to be angry. You're ashamed when you're experiencing big emotions. When we experience and learn this as a child, we have the propensity to continue this through adulthood. And we literally collect these trapped emotions daily. And not to mention those of us that are sensitive and empathic, we can take on others' emotions as well as our own. So these emotions and frequencies and energies can be stored in various areas or organs. And again, this becomes the blocks, this becomes the stagnation, this becomes the physical manifestation of signs and symptoms and diagnoses like food allergies and intolerances. When we identify the emotions, where they're held, what needs to be released, we see significant and easeful shifts in our physical state, our health, our wellness, and our well-being. And these can be shown and reflected in many ways. So in different areas of our lives, in our relationships, in our business, in our career, in our family, in our fertility, and again, in health. This pillar of the protocol is so powerful and unique because we also partner with the divine, your higher power, your spiritual connection, your higher self, whatever word you use. We access wisdom and discover how to nurture this relationship with the divine. There are multiple ways that we do this, and some include divine muscle testing, which is an advanced form of kinesiology. We use intuitive eating. We learn to ground ourselves in trust and faith, and know deep within us that in one way or another, this experience is for us, that everything is working out for us. This is all happening for us. This is an example of how I integrate the Eastern and Western approaches, alternative practices for a truly holistic and integrative experience, because we need spiritual alignment for our physical health as well. And when we don't have this alignment and we're not working with our emotions and our energies, they become the root cause of our signs and symptoms. And when we see that energy and frequency really is the root cause of every single condition or symptom that we may have, we become empowered to work with them and not be as afraid of them. And I'm here to help you along that way. We don't have to dive in faster than you feel ready to, because I know for some of you, I know when I first started doing this, it was terrifying, long, long ago. So the way I do this is gentle. I pay attention to your needs, what you're ready for. And we proceed in a way that feels good to you, because again, I am a trauma-informed practitioner. So again, if this aspect of emotional energetics and spiritual alignment is an area where you just got a light bulb moment, because it made such a huge shift in my personal health journey, my daughters, and so many clients, put series in the comments and I'll send you the link again for the full masterclass series, and you'll get the bonus trainings and resources as well. So if you are ready to explore emotional energetics, the underlying root causes of food allergies and intolerances, click below for that special month of support package that's 89% off for a limited time. You get custom solutions for your journey to address your root causes in a way that is in alignment with you and working with your body. And for practitioners, I want to check in with you as well. Is this an area that you may not have been aware of? I know myself, years ago when I was working in the clinic, I did not know this connection at all. And I missed this part in many of the patients that I was working with in the clinic. And now I can see why certain patients didn't make improvement. I can see what was missing. And I want you to know that as a practitioner, if there are clients that are coming to mind for you, that they're like, you're recognizing that they need this, that this is the answer for them, put practitioner in the comments and I'll send you the information about the mentorship. Together, we can make such a profound impact on the world. So the last pillar that we're going to go over is number 6, decoding your body. And this is the one that ties it all together. Your body communicates continuously. When we learn to decipher its messages and address root causes, rather than masking symptoms with Band-Aid solutions, everything changes. Because we can use how the body is presenting to give us clues and understanding of what the most important underlying root causes are and how to address them for each person. Can you feel a shift in energy around that? Put a 1 in the comments if you feel it and you like it. Because what that means is that when we see our allergic reactions, we don't see them as bad anymore. Right? Quote unquote bad. We see our signs and symptoms as a way that the body is communicating with us. We see that the body is putting up a flag that something is out of alignment, that we need to shift something. When we see our signs and symptoms as clues, beneficial, and helpful on our journey, we no longer resist them. We enter a state of acceptance, of flow, of love, and we enter in union with our body as our ally. We no longer shun our body or see the signs and symptoms as bad. We understand that it is all good. In some ways, it is protecting us, and it is here for us. There is a level of consciousness and awareness that we bring when we start really paying attention to our body and what it's communicating. And we allow this to guide us in our decisions. Ultimately, our body is the gold standard when making health decisions. Like we mentioned earlier, an oral food challenge is the gold standard. We're going to go over some decoding techniques in a minute, but I really want to emphasize this. Our body's responses to whatever we try, our food that we trial, a supplement, etc., that is the gold standard. That is how our body communicates with us, and we need to learn to listen to it. That's why when I work with clients, I partner with them on their health journey. I make recommendations based on evidence-based practice, which looks at the research, my experiences and knowledge, training, and the experiences that I've had working with clients, and the client's experiences. Each client is their own ultimate judge. You are your own ultimate judge, and you make the final decision to only do what feels in alignment with you. This is one of the biggest differentiating factors compared to working with other practitioners who just tell you a list of supplements or medications to take and send you on your way without checking in with how that feels for you and working with you to create a plan that's in alignment with you. We tap into your body's innate wisdom to access exactly what is in the highest and greatest good for us in any moment, using divine muscle testing, which is, I mentioned earlier, an advanced form of kinesiology testing, and learning the signs and symptoms that the body gives us. So we use the divine muscle testing, we use intuitive eating, there are at-home tests that I coach and guide you through. Sometimes we get lab work. And again, if you are working with an allergist, we use those results from the skin and blood testing for information. Or even if you did go ahead and get the food intolerance testing done, we use that as well. This is all made to empower you. This is the root cause of anything that you've tried in the past that hasn't worked for you. It may not be that whatever food it was or supplement, it may not be that it was quote unquote bad. It just wasn't in alignment with you, with your body, and where you are on your health journey. How powerful would it be to access this knowledge from within your body? How much would that change your food allergy experience? How much ease and joy would that bring to your life? How much would that free up of your precious resources of time, money, and energy? How would you be able to connect with your partner differently, with your child differently, with family and friends differently? How empowered would you feel? Put series in the comments if this is an area that you realize you've been out of alignment with on your food allergy journey so far. Again, I'll give you the full masterclass series for free with all of the bonuses and the special video that's just on decoding the body. And if you're ready to discover the power of decoding your body and address the root causes of your signs and symptoms, click below, get the full special right now. That's a full month of support at 89% off the regular price. You get a full consultation, one-on-one, an assessment and evaluation. You get troubleshooting, questions and answers. You get community coaching. This is what creates the transformation. When you have the support and guidance and you have someone holding your hand through the process. So as we've gone through this whole protocol, some of you may feel overwhelmed. It's a lot, I get it. And I want you to know that with my system and guidance, we integrate this all beautifully and easily. In every session, we touch on multiple, if not all of these pillars. And I guide you through a beautiful process of connecting the dots between the physical, the mental, the emotional, and beyond. So take a moment to consider what's been missing on your journey. Is there a certain pillar that comes to mind? And how amazing would it be to have all of these pillars working together for you and your highest health and wellness potential? How would that change your health experience? How would that change your food allergy and intolerance journey? How much ease and joy would that bring to your life? How much would that change your relationship with your kids, your partner, your family members, friends? How would it impact social situations and interactions? How would it impact your business, your career, your parenting, your finances? How much would it free up your precious resources of time, money, and energy? How empowered would you feel? Because it doesn't matter what elimination diets you've tried, or the supplements that you've tried, or even the energy work that you've tried. If it's not in alignment with your body and where you are in your journey, you won't see results. And if you don't address all 6 of these pillars quantumly and integratively in a holistic way, you may see some benefit, but you'll get stuck or you'll dread your experience going through it. Because it's all about alignment and working with the 6 pillars together. It's all connected. It's never just one thing like an elimination diet alone. Because yes, that can decrease the inflammation of having repeated reactions, but there's inflammation and an immune response that we have to heal. We need to heal the gut. We need to regulate the nervous system. We need to free up our life force, working with emotional energetics. We need to align with our spirituality and the divine. So with this, we work with the body as an ally. The body is quantum, it's a universe, and that's how we need to work with it and approach it as well. And that's why you haven't gotten results with other practitioners, like an allergist, because you're only focusing on elimination or taking a supplement or a medication. We need to be addressing all 6 of these pillars that are the underlying root causes. And if this approach resonates with you and you're ready to identify and address the root causes that will create the shift for you on your food allergy and intolerance journey, allow you to heal and resolve symptoms, put Radiant in the comments, click below, and get the discounted package with a month of support today. So before we go into frequently asked questions, I want to spend some time on your next steps. Some of you want to take this information and figure it out on your own. Some of you just want to keep working with your allergist, and I'm here to support you no matter what. You're going to get so much benefit from the rest of the masterclass series and resources that I really urge you to sign up for that, because you're going to get action steps and things that you can start implementing today. And some of you want a little extra help. So that's why I have the course on dairy available, on reading labels, right? So if you put course in the comments, that course is specifically for reading labels, learning how to communicate. It is primarily focused on dairy, but no matter what allergen you are removing from your diet, then this will be beneficial for you. And at the same time, you also experience a one-on-one guidance call with me as well. So that's where we start to put the pieces together for you specifically. And I also have a whole YouTube channel with playlists specializing in various topics, especially lots of support for moms, breastfeeding moms, gut health, and more. So you can just search Dr. Beata on YouTube and subscribe and check out those playlists. You can put YouTube in the comments as well, and I'll get you the direct link. I also wrote a book on our experience, Breastfeeding Bliss. Like I mentioned earlier, it's a supportive book that shares our personal journey of food allergies with the breastfeeding component added in. So I highly recommend this for any food allergy individual or family, even if you haven't been breastfeeding, and specifically if you have been breastfeeding. In this book, there are resources, there are guided practices that will transform your experience. And it is on sale on Amazon right now through the end of Food Allergy Awareness Month, through the end of May. And you can also get a signed copy on my website. I also have a food elimination tracker and trial tracker, so you can go ahead and put tracker in the comments and I'll get that for you. And for those who don't want to go through the trial and error and you don't want to make mistakes, you want to get answers and solutions faster, you want to heal and resolve your signs and symptoms, I have a full month of support available that includes a consultation one-on-one, assessment, evaluation. You get resources, you get community coaching, you also get multiple troubleshooting. So you get to email me your questions and I'll respond to you. So even if it is 2 a.m, that's what I needed in that moment. I didn't need to wait 6 weeks, 8 weeks between appointments. I needed multiple checkpoints. And that's what I'm giving to you, the experience that I wish I had going through this. And with all of this, we create your custom protocol. Right now, it's 89% off, and it's only going to be for a limited time. So go ahead and click below, sign up now, or put Radiant in the comments, and I'll get you the direct link. Now, for those who stayed with me to this point and are watching live or through May 2024, which is National Food Allergy Awareness Month and Celiac Disease Awareness Month, I have a special offer for you. I usually have a limited number of discounted consultation packages each month. And because you've been here with me and my heart really goes out to you and your food allergy experience, I know what it's like. I'm going to offer you an extra 10% off to take advantage of this limited time special until May 30th, 2024. For those who registered, you'll get an email with the discount code shortly. And if you haven't registered yet, comment food allergies and I'll get you the registration link. With this full concierge support package, you feel like someone is holding your hand through the whole process. You get your questions answered in real time. You get troubleshooting, Q&As, resources, community, private events, and so much more. What this looks like once you go to the website and enter your information is that right away, when you sign up for that full month of support, you get a confirmation email that has forms for you to fill out and the link to schedule your consult. I spend a good amount of time going over these forms to identify what the root causes are and your history, so you want to be sure to fill these out before scheduling. The consultations are on Zoom and they are private. So throughout the consult, I'll have follow-up questions based on what you filled out, and I'll hold space for you to share your experience. I'll ask questions, etc. And then based on all of this information, we'll come up with a plan together that is effective and feels good to you. Something that's not overwhelming and will give you enough to work through for the month, and will focus on what's most important for you. You'll also get immediate access to the live program. So there you'll get the full protocol, you'll get videos, trainings, and you'll be able to start engaging in the community. And after your consultation, you get access to me via email and that private community. You get access to the resources, an opportunity to connect with others, 2 community coaching sessions a month, Q&As, again, email troubleshooting. You get to ask me any questions that come up. No matter the time, no matter the day, I don't want you staying up all night worrying. I'm here to support you. Know that if you send me a question in your email, I'll be working on it for you. And towards the end of the month, we'll have a check-in and a short follow-up to fine-tune your experience. And what's great about the Radiant Health and Wellness Program and protocol is that I like to make health and healing very fun and approachable to every aspect of your life. So the experience that you get when we work together is comprehensive and complete concierge care. It's life coaching included. And it's easy to apply. You get cheat sheets so you don't feel overwhelmed. You get your questions answered in real time, troubleshooting. You get to check in with me so we modify and tweak your experience based on your body's responses. And this is what makes it so powerful and effective. So for those who are ready to address the root causes and transform their food allergy experience from confusion and overwhelm to one of clarity, confidence, and calm, I have this consultation package. It's currently 89% off for a limited time only. You get a full month of support, one-on-one consultation. It's for those who want to get results faster, who want to avoid mistakes, and who want to really learn how to embody and use these pillars of the Radiant Health Protocol. So click below and get the results and healing that you want and the support that you need now. Again, for those of you that are listening live in May 2024, check your emails for a 10% discount. Now, I want to wrap up with a few frequently asked questions about food allergies and intolerances. So one of the first ones that I get is, are food allergies genetic? So yes, they are. There is a genetic predisposition for food allergies, and there's no guarantee that if you are a parent that your child will have food allergies, and at the same time, one child may and the other may not. That is where our unique blueprint comes in. That is where our unique experience, our emotions, our gut health, our nourishment, how was our experience in utero, all of these things come into play. So also I want to mention that through epigenetics, we can influence our genetics. So the activation and the expression of our genes and our DNA can be affected with our lifestyle choices, our diet, our stress levels. So I want to empower you and help you feel this agency that you do have over your genetics. Another question that I often get is, can you have an allergic reaction to any food? Yes, that is a big yes. And not only any food, you can have an allergic reaction to any food derivative. You can have a reaction to proteins, to fats, to carbohydrates, to chemicals. So yes, you can have an allergic reaction to any food, any ingredient, any substance. Now, the other thing that I want to mention is that in some of the names of these food allergies that we went over, so for example, food protein-induced enterocolitis or food protein-induced allergic procticulitis, in the name, or milk soy protein intolerance, in the names, it implies that it's a protein. That is a misnomer. It is not just the proteins that can create a reaction. So you can have a reaction to an oil. And that is something that some allergists don't even know, because they'll say, no, it's impossible. It needs to be a protein. No, that's where I step in and say, from personal experience and experience of my clients, that yes, you can have a reaction to an oil or a food derivative. It does not have to be a protein. So it's important to clear that up as well and to validate the experience that some of you may be having. And can you have a reaction at any time, even to foods that you've had before? The answer again to that is yes. So even if you've had a food 100 times before, you can have a reaction on that 101st time. Now, it depends on the journey and each person's individual story. And when a food allergy just shows up randomly, that's where I look at the greater picture. What was happening in the person's life? Was there some emotional event happening? Was there something energetically happening? What were stress levels like? What was nervous system regulation like? Was there a toxin exposure? Because something set off the immune system to become overreactive. And again, when we work with root causes, we can identify and address that. What are some common triggers? So we talked about the top 14, which includes some unknown ones, but some of the most common ones are milk, soy, eggs, nuts, tree nuts. And again, the top 14 list, you can Google it as well, but I mentioned earlier in the presentation, some of the specialties that I have, gluten is the other one, right? With celiac disease, with corn allergy, those are tricky. Those are trickier than some of the other ones because of the derivatives and the places and cross-contamination and trace amounts. So if that's something that you have and you think that it is maybe too complex, I want you to know that I have personal experience with that, and I can guide you through that journey and creating a plan specific for you as well. Another question that I often get is, do food sensitivity tests work? So we covered this earlier as well, but it's a good time to repeat it, is that no. Food sensitivity and food intolerance tests are highly inaccurate. So they give a lot of false positives and they are not accurate. They can be a tool. So if you'd like to get one, that is great. I don't make my clients get one. We use other methods in decoding your body to start understanding and recognizing what is creating inflammation and irritation in your body and what you're reacting to. And one of the biggest questions that I get is, do you grow out of it? So do you grow out of food allergies or intolerances? So my general answer is no. And then I follow up with, can there be resolution of food allergy reactions and signs and symptoms? And my answer to that is yes. And you may be going, wait, aren't you contradicting yourself? So when I see signs and symptoms go away, and when people stop reacting, stop having allergic reactions to a food that they have previously, one of two things happens. The first is that ideally the root causes were resolved. So whether that was a nourishment root cause, an emotional energetic root cause, where the emotion or the energy was processed and integrated, where the nervous system regulated, where the gut healed enough, whatever it was, the root causes resolved so that the reactions and the signs and the symptoms no longer present. Now, the second thing that happens is that someone may have a certain presentation. So maybe they had eczema a lot as a child, and all of a sudden the eczema goes away. Does that mean that they grew out of that food allergy because the eczema is going away? Sometimes, right? We talk about the root causes being resolved. But when we take a look at the history and the signs and symptoms, the signs and symptoms shift. So if someone had eczema as their main presentation as a baby, maybe as they get into childhood, now they have chronic constipation. Or maybe they had reflux and now they begin having diarrhea. That is just a shift of symptoms. It is not a resolution of a food allergy or intolerance. So I want to make that distinction, because the only way that you can get resolution is by addressing the root causes. You don't spontaneously grow out of it. A root cause was addressed appropriately, one way or another. Sometimes that happens without, like spontaneously, we can call it without us knowingly knowing what was done. But on an energetic level, on an emotional level, nervous system, gut health, nourishment level, that's what happened. So another question that I often get is, what is the difference between food allergies and intolerances? So that we answered in depth at the beginning of the masterclass. So make sure you go back and listen to part 1, because during that portion, we discussed the difference between IgE allergies, non-IgE, and food intolerances. And then we broke that down further into different conditions and presentations as well. So make sure that you watch that part 1 for all of that. And another question I get is, can food allergies be misdiagnosed? And again, the answer is yes. Sometimes, especially the ones with GI symptoms, get misdiagnosed as a stomach bug or food poisoning, or they can be downplayed as food sensitivity, which again is a reason why I don't use that name, because when we are talking about this, we need to look at the root causes. And intolerance is more of a digestive issue that, again, is a lack of an enzyme to digest certain food components. So we need to address that. And if it is an IgE or non-IgE allergy, we're working with the immune system. So we have to address that component to it. So those are the questions that I had. Let me know what other questions you have in the comments. And again, put a 1 in the comments if this masterclass was helpful, if you learned something new, if you started connecting some dots in your journey, on your journey, and putting the pieces together of your story and your food allergy and intolerance experience. And again, I want to extend this invitation for those of you who want to work together, who want to get to the root causes, who want to resolve their signs and symptoms and heal. Go ahead and click below, get the full month of support package that's 89% off for a limited time. And I'm here to guide you and support you on your journey fully. And as always, I wish you and your loved ones all the best, and I will see you in the next masterclass videos. Make sure you sign up for this link.